Hello and welcome back to Unacademy. So let's crack NEET PG. Myself, Dr. Muskan Chaudhary, and today we'll covering the General Bacteriology in one session. So it will be a marathon-like session uh matlab 1.3 hour to 2 hours, right? And as we know that Unacademy is India's largest learning platform, and with the plus subscriptions, we get the access to both the live and the recorded sessions. And soon, you will be able to record the class anytime and anywhere. So this is the perk, and from the topmost educators who are teaching online for the aspirants or preparing for all other examinations as well, and can give the live test and quizzes to help you evaluate your preparation for the coming examination. And SS, you can actually get access to all the question banks by the topmost educators, and soon the printed notes that will be provided with the plus subscriptions, and that is valid up to 11th of this month. After that, only with the icon subscriptions you will get the uh, these notes. Now icon subscription is something that prep ladder has come together with the Prep Ladder has come together with the Unacademy, and as we know, Prep Ladder is one of the best coaching platform along with the Unacademy for the NEET PG. And the video lectures, the rapid revision courses of the Prep Ladder are very famous. You get the well-structured live batches and the competitive live T&Ds of the Unacademy, and comprehensive and the printed digital notes. Right, and with the 12-month subscriptions, you get 2 month subscriptions totally free from the Unacademy, and that is a very great benefit for those students who are preparing for the 1 year, who are the interns and the post interns, and 4 year subscriptions for those students who are in the second year. And they can second and third year, they can take 4 year subscriptions, that because the per month the plus subscriptions accounting for per month is comparatively low compared to other online coaching platforms. Now, 1 year, it is around 40,500 after 10% of the discount, right? And you can use my code, that is Muskan10, to get the 10% of the discount on your NEET subscriptions. Grand test on an Academy platform every day. Grand test from 9 a.m. to 12 p.m. From 9 a.m. to 12 p.m. every day, the grand tests are being provided free of cost by the Unacademy platform. So you can actually check out and help you analyze your preparation. And please give the grand test to help you evaluate your performances, as well as to help you build your sitting capacity for a coming examination. Right. So first we'll talk about the general microbiology, and first we'll talk about the important scientists, the one liners that are important to remember. At first we'll talk about the Sir Anthony Van Leo Van Hook. Okay, and he was the first. He was the first to observe the bacteria under the self-made microscope, and he named these smaller organism as the small animalcules. Okay, Sir Anthony Van Hook actually coined the term small animalcules. Next is the Edward Jenner. I think everyone knows about it. He actually developed was the first vaccine of the world, and that was what? That was smallpox vaccine. And he coined the term vaccine. Okay, so Sir Edward Jenner, he developed the first vaccine of the world. That is what the smallpox vaccine. Now, next is what the Louis Pasteur, Sir Louis Pasteur, and he is what father of microbiology. Yes, Louis Pasteur is father of microbiology, and he gave the pasteurization of the milk. Since pasteurization of milk is for nothing, but it is what? It is preservation of the food. So he gave the method of the fermentation and preservation of food. He also gave the sterilization technique that we use, like autoclave, plasma sterilizers, hot air oven. ठीक है. तो सर एंथनी वैन ल्यू he gave the coin the term A for A, that is small animalcules. Edward Jenner, he actually gave the vaccine, smallpox first vaccine. Louis Pasteur gave the pasteurization of milk, gave the fermentation and technique and sterilization methods. Apart from this, he also gave the germ theory of the disease. He also gave the germ theory of the disease and used the nutrient growth to grow the microbes. Right? So this is important. And one more thing is that he also developed vaccine for what? Anthrax. Right? He also developed vaccine for the anthrax and the rabies. Now coming to the next scientist, that is yeah, Sir Joseph Lister. That is how we remember Sir Joseph Lister. That is, we actually changed the spelling to father of antiseptic surgery. And why he's called as Joseph Lister is called the father of the antiseptic surgery, because he actually saw the use of the diluted carbolic acid. Okay, he actually saw the use of the diluted carbolic acid, and when he saw that when they use the diluted carbolic acid to sterilize the surgical instruments, the post-operative infections greatly reduced. Okay, so Sir Joseph Lister, how we remember that LISTER, that is the father of the antiseptic surgery, and when we use the diluted carbolic acid, the post-operative infections greatly reduces. Now next is the Robert Koch. Okay, that is the father of he is the father of modern microbiology. Okay, his father of Robert Koch was father of modern microbiology and also introduced the solid culture media, and he isolation of the bacteria in pure culture. He described the hanging drop method to see the motility, right? And other than this, he discovered bacilli bacteria that are anthrax bacilli, tubercle bacilli, and cholera bacilli. Other than this, he also gave the staining techniques by using what? Acridine dye. Now, how to remember this? देखो रॉबर्ट कॉच इज द फादर ऑफ द मॉडर्न माइक्रोबायोलॉजी, क्योंकि उसने कॉच फिनोमेना दिया था. दूसरा ये है कि हम जो कॉच फिनोमेना पढ़ते हैं उसमें क्या होता है कि आइसोलेशन ऑफ बैक्टीरिया ही अपन करते हैं. सो इट इज इजी टू रिमेंबर दैट ही आइसोलेटेड बैक्टीरिया इन द प्योर कल्चर्स. ठीक है. एंड उसने सॉलिड कल्चर मीडिया पे किया. वी कैन रिमेंबर दिस की isolated the bacteria in the solid culture media by using the staining technique and saw the motility of the bacteria. So this is how we can remember Sir Robert Koch, that he isolated the bacteria in the pure culture on the solid culture media and to see the hanging of motility and staining technique. So these are some things that are being described by the Robert Koch to will help you remember. ठीक है. एंड डिस्कवर्ड व्हाट, क्योंकि रॉबर्ट कॉच मेनली रॉबर्ट कॉच कॉच फिनोमिना है, ही सॉ ऑन द ट्यूबरकल बेसिलाई. तो जितने बेसिलाई हैं, 3 बेसिलाई हैं, दैट वर डिस्कवर्ड बाय द रॉबर्ट that caused, that is the anthrax bacilli, tubercle bacilli, and the cholera bacilli. So easy to remember. Now there are exceptions of Koch phenomena. That is the Koch postulate ने क्या कहा था? Actually he saw that कि tubercle bacilli when that was injected, inoculated into the guinea pig that was already sensitive, actually developed the hypersensitivity reaction. ठीक है? तो Koch postulate में चार चीजें हैं, that the organism should be constantly being associated with the disease. ठीक है, constantly being associated, जो भी disease कर रहा है, that is it is possible to isolate those bacteria from the disease. ठीक है, and it is possible to produce the same disease in the experimental animal when inoculated with the bacteria, and it is possible to re-isolate. ठीक है, तो कुछ नहीं, constantly associated with a single disease, and it is possible to isolate those bacteria from that disease and produce the same clinical disease in the animal model that we are using, and it is possible to re-isolate from that disease has been caused in the animal model. Now, fifth criteria और था that the specific antibodies will be present in the serum of the patient. Now, exceptions are important. Exceptions are important that can be remembered by the mnemonic, that is a M and T. Exception को याद करने के लिए we use the mnemonic, that is the M, N and T. That is M for Mycobacterium leprae, N for Neisseria, ठीक है, and T for Treponema pallidum. These bacteria do not follow the Koch phenomena, and we have to remember this. It is MNT, that is the Mycobacterium leprae, Neisseria, and the Treponema pallidum. And Neisseria, actually, there is no animal model for Neisseria to see the Koch phenomena. That is, no animal model is present. While for the Mycobacterium, this Treponema pallidum, it does not grow in vitro. ठीक है, तो MNT is a mnemonic to remember the Koch postulate, that is a Mycobacterium leprae, Treponema pallidum, and Neisseria. Neisseria, there is no animal model, and it is not possible to grow the Mycobacterium leprae and the Treponema pallidum in the growth them in vitro. Now coming to the next scientist, that is Sir Paul Ehrlich. And we remember that everything that is related with the Paul Ehrlich is something that is related to immunity. ठीक है, that is from the CH, that is the father of chemotherapy. He is father of chemotherapy. ये भी immunity से related है. इसके अलावा he gave what Ehrlich phenomena. That is the method of standardizing toxin, antitoxin. ठीक है, and another is that he gave the side chain theory of antibody production, and the bacteria, that is Ehrlichia, is named after him. ठीक है, तो something that is related everything with the immunities with Sir Paul Ehrlich, that father of chemotherapy, Ehrlich phenomena, the side chain theory of the antibody disease, and he also described the acid fast nature of tubercle bacilli. ठीक है, so his father of chemotherapy, standardizing toxin, antitoxin, side chain theory of antibody production, Ehrlichia was named after him, and acid fast nature of tubercle bacilli. Now, some one-liner scientist that we have to remember is the Hans Christian Gram. So he gave what? He developed what? Staining technique, that is the Gram stain, named after him. Now, next is what? Sir Ernst Ruska. E for E, that is, he is the founder of the electron microscope. The Alexander Fleming, everyone knows that he gave the most popular antibiotic of the that is the penicillin. The good pasture, he actually develop the chick embryo culture. ये कैन बी इस बार की जी अपन ऐसे रखते हैं जी, दैट इज द कल्चर चिक एम्ब्रियो कल्चर. बारबरा मैक्लिंटॉक, she described what? Transposons. And Carrie B. Mullis, he received the Nobel Prize for the discovery of what? PCR. ठीक है, तो Hans Christian Graham gave the gram staining technique. Ernst Ruska from E to E, that is gave the electron microscope, developed the electron microscope. Alexander Fleming gave the penicillin antibiotic. And the good pasture, that is G is written like the C, so chick embryo culture. Barbara McClintock, she gave what? Transposon, described the transposons. And Carrie B. Mullis, that is he discovered what? PCR. Okay. Now moving next to the next topic, that is the we are done with the important scientists. Now that is the sterilization and disinfection. Okay. Now, what is actually the meaning of? There's a difference between the sterilization and disinfection, asepsis, cleaning. ठीक है, so these are some basic difference, there are some basic difference between these term. तो sterilize का मतलब क्या? ऐसे ऐसे याद रखो कि vegetative form को भी it will cause the death of the vegetative form as well as the spores. तो ऐसे as that spores will also be destructed by the sterilization method. जबकि disinfection में सिर्फ only vegetative forms will be harmed and they will be killed but not the spores. It is also further of two types, that is the high level, intermediate level एंड लो लेवल डिसइंफेक्टेंट. ठीक है, तो हाई लेवल में क्या है? वैसे तो डिसइंफेक्टेंट ओनली किल्स द वेजिटेटिव फॉर्म्स, बट अगर अपन हाई लेवल डिसइंफेक्टेंट यूज करते हैं प्रॉपर कॉन्सेंट्रेशन, इट विल आल्सो किल द स्पोर्स, while the rest of the intermediate and low level will not kill the spores, and even the low level will not even kill the tubercle bacilli. ठीक है, now coming to the asepsis, that is the when the living tissues are made free of pathogen, that is we are using on the living tissues. Now coming to the cleaning is what? Cleaning also decontamination. Okay, now cleaning doesn't means to clean all the pathogens from the surface, it is actually what? The reduction of the pathogen to a safe level, that it is no more a public harm, and that too without any protective attire. Okay, that we do not need to use any protective attire to protect ourselves, our skin. And the cleaning is a method of the decontamination where pathogen is reduced to a decreased level to a safe level where it is no more a public harm. Okay, so this is about the some important definitions. Sterilization SAS के spores भी हट जाएंगे, they will also be killed. Disinfection में only vegetative forms. Asepsis is used for the living tissues to made it free of the pathogens. Cleaning is the decontamination to reduce the pathogen to a particular safe level. Now coming the factors that are affecting. Okay, factors that are affecting the sterilization and the disinfection, that is one is the organism load and the organism nature. ठीक है, अगर लोड ज्यादा है तो obviously we'll need to you increase the concentration of the disinfectant sterilization whatever we are using. And on the nature, because most resistant, this is important to remember, that most resistant are the prions. ठीक है, and the least resistant are what? The enveloped virus. Now what comes in between? That is the most resistance is prion, then is the bacterial spore, then is the coccidian oocyst, then is was the mycobacterium, then is the non-enveloped virus, then is the fungus, then is the vegetative bacteria, and least is what? Enveloped virus. Okay, so at least remember the first two and the last two, even in case you do not able to remember complete that. Most resistant क्या होते हैं? Prions होते हैं, फिर उसके बाद bacterial spores होते हैं, and least resistant is the enveloped virus and the vegetative bacteria. So this is about the resistance. We are talking about disinfection towards sterilization and the disinfection, and this sequence is important. इसके अलावा तीसरा फैक्टर ऑर्गेनिज्म लोड, ऑर्गेनिज्म कॉन्सेंट्रेशन तो फर्क करेगी. इसके अलावा व्हाट एज द कॉन्सेंट्रेशन ऑफ द disinfectant or the sterilization we are using. Other than this, the contact time, that is from the application. Contact time is counted from the application till drying. Now, next is what the temperature, because as the temperature increases, the activity of the disinfectant and the sterilization also increases. Next is we have to also look out the stability of the compound that we are using, because there's like the hypochlorite. Okay, it tends to evaporate. Therefore it is prepared freshly. Next is the pH. In some cases, the increased pH will help in the increasing activity of the disinfectant, like for glutaraldehyde. And quaternary ammonia compound. And next is decreased pH will help in the increasing the pathogenic antipathogenic activity, that is what for the phenols, for iodine, and for the hypochlorite. Okay, that is increased pH is used for what? For the glutaraldehyde and quaternary ammonia compound is really favorable, while decreased pH will be for phenols and the iodines. Okay. Now next is what the relative humidity is important to remember. कहाँ पे relative humidity is important to for seeing the disinfectant property, that is for the ethylene oxide. Now next is the organic matter. Organic matter क्या होता है? It tends to decrease the activity of the disinfectant, antipathogenic activity, and mainly for what? Quaternary ammonic compound and hypochlorite. But in some cases that we have to remember, that is phenols, and the glutaraldehyde, they actually retain their efficacy, even in the presence of organic matter. Okay, so phenols and glutaraldehyde, they actually retain their efficacy in the presence of the organic matter. So it is important to remember that phenols and the glutaraldehyde, they retain the efficacy in case of the organic matter, and to decrease the level of the organic matter in case when we are applying the disinfectant. And what we can do, we can actually increase either the exposure time of the this disinfectant, or we can before using the sterilization technique, we can actually clean the surface. That is, we can do the mechanical cleaning of the surface and increase the exposure time. So this was about the factors that are influencing our main. We have to remember that even in the presence of the organic matter, phenols and glutaraldehyde will have no effect. Other, we have to remember that prions and the bacterial spores are the most resistant, and the least resistant are the this enveloped virus and the vegetative bacteria. Okay, and another we have to remember that. The relative humidity is important to for show the disinfection potency for the ethylene oxide. Now, one is the Spalding classification. Okay. Now, Spalding classification, what he actually did, the scientist, he actually divided the medical equipments, that is, he divided the medical devices, okay, according to the risk of infectious risk of infections involved in use. ठीक है, तो व्हाट ही इज स्पाल्डिंग क्लासिफिकेशन, व्हाट इज द मेन क्लासिफिकेशन क्राइटेरिया, क्या इन्होंने क्या किया था, मेडिकल डिवाइसेस को डिवाइड कर दिया था नॉन क्रिटिकल, सेमी क्रिटिकल एंड क्रिटिकल ऑन द बेसिस ऑफ द यूज ऑफ द मेडिकल डिवाइसेस एंड द रिस्क ऑफ द इन्फेक्शंस दैट इज पॉसिबल फ्रॉम दोस पर्टिकुलर डिवाइसेस। कुछ मेडिकल डिवाइसेस ऐसी होती है जो अपने से स्किन पे टच होती है, कुछ ऐसी होती है दैट आर एक्सपोज टू द म्यूकस मेम्ब्रेन एंड सम दैट आर यूज इन सर्जिकल एंड सर्जरीज एंड ओटीज, सो दे आर द हाईएस्ट रिस्क ऑफ कॉजिंग द इन्फेक्शंस। तो उनके लिए क्या क्या लेवल ऑफ disinfections are important to apply for them। ठीक है, तो अपन बात कर रहे हैं किसकी, स्पॉल्डिंग क्लासिफिकेशन की। ठीक है, he actually divided what the mechanical devices into what, into non critical, semi critical and what, and critical। दैट इज अ नॉन क्रिटिकल, सेमी क्रिटिकल एंड द क्रिटिकल। तो नॉन क्रिटिकल में तो अपने कौन से आएंगे, दैट इज द डिवाइसेस दैट आर एक्सपोज टू द इंटेक्ट स्किन, while the semi critical to the mucous membrane, and the critical that is either exposed with the blood of the person, and that is the during operation we are using। ठीक है, तो intact skin में that is like the BP instrument and the stethoscope and all। for the mucous membrane जितने भी scopes हैं, that is bronchoscope, endoscope, and here the surgical instruments। ठीक है, now non critical, because they are non critical only the intact skin, so low or the intermediate level of the disinfection is enough, while here the high level of disinfection is needed, and here the sterilization is needed। ठीक है, now what are the methods of the sterilization, high level, low and intermediate level, we'll remember this क्योंकि critical में we need to sterilize, so sterilization technique, semi critical में high level of disinfection and non critical में low or the intermediate level of the disinfection। Now first we'll talk about this heating techniques that we are going to use for the sterilization, that is the autoclave or the steam sterilizer। But before discussing the autoclave, we'll read a little about less than 100 degrees Celsius temperature. That is the most heat technique we'll talk about। The moist heat technique में सबसे पहले अपन किसकी बात करेंगे, one is the less than 100 degrees Celsius temperature। तो उसमें सबसे पहले अपन बात करते हैं pasteurization की। Now pasteurization of milk is by two methods, that is one is what the holder and another is the flash। ठीक है, तो holder is boiling for 60 degrees Celsius for 30 minutes and here 72 degree Celsius for 20 seconds and then cooling to लेस देन 13 डिग्री सेल्सियस। तो होल्डर मतलब होल्ड करके रखना, तो काफी देर तक होल्ड करके रखेंगे तो 30 मिनट के लिए, फ्रॉम 3 to 3 दैट इज 63 डिग्री फॉर 30 मिनट्स। नाउ फ्लैश मेथड, दैट इज होल्डर में भी have a holding, now flash in a flash will boil it then will cool it, so for 20 seconds for 72 degrees Celsius and then cooling down to 13 degrees Celsius। Now less than 100 is another technique, is what that we are going to use is what, incipation। ठीक है, तो इंसिपेशन में कुछ नहीं करते, वी आर एक्चुअली कॉन्स्टेंटली हीटिंग एनी दैट वॉट एवर वी आर गोइंग टू disinfectant the media that were mainly used by the inceptions because they are the LG media and Loeffler serum slope media, because ये generally media they are what disinfected by the autoclave but they are damaged by the autoclave, so LG mediums and Loeffler serum media we do not use sterilized by the autoclave, we sterilize by incipation। एंड इंसिपेशन मीडिया में अपन क्या करते हैं कि डे 1, डे 2 एंड डे 3 पे क्या करते हैं, कॉन्स्टेंटली हीट करके रखते हैं, दैट इज फ्रॉम टेम्परेचर 80 to 85 फॉर 20 to 30 minutes for continuous 3 days। कॉजिंग द इंटरमिटेंट हीटिंग। तो इसका फायदा क्या होगा कि डे वन पे अपने हीट किया, ठीक है, फॉर 20 to 30 मिनट्स हमने डे वन पे हीट किया, तो व्हाट विल हैपन, द वेजिटेटिव फॉर्म ऑफ द बैक्टीरिया विल डाई, ठीक है। नाउ सेकंड डे विल अगेन हीट, तो वॉट एवर द स्पोर्स दैट हैज रिजल्टेड इन टू फॉर्म द वेजिटेटिव बैक्टीरिया दे विल डाई, एंड ऑन द थर्ड डे विल अगेन हीट, तो व्हाट विल हैपन, जो स्पोर्स, जो बचे हुए स्पोर्स थे जो वेजिटेटिव फॉर्म में कन्वर्ट हो गए, they will also die. So this is how we use incipation for less than 100 degrees Celsius temperature for the local serum slope and the Algae media. Now coming to more than coming at 100 degrees Celsius temperature. Now one is that we do is the boiling. Okay, boiling at 100 degrees Celsius temperature, but this will not kill the spores. And another is the tinderlization technique. Okay, so tinderlization technique is also it is actually boiling, it is actually heating at 100 degrees Celsius temperature for 20 minutes at 100 degrees Celsius for 3 days. That it is also the heating for the 3 days for at 100 degrees Celsius temperature, that is the tinderlization. Now coming to the more than 100 degrees Celsius, when we are talking, we'll talk about the autoclave. Autoclave or the steam sterilizer, because it is based on what, the moist heat technique. Because it is based on the moist heat technique, okay. So it actually destroys the organism by irreversible coagulation and cause the destruction of the enzymes, okay. Now moist technique में क्या होगा कि first will create a vacuum so that the air inside the autoclave is removed. Then we start boiling the water so that when the atmospheric pressure increases, the temperature at which water boil will also increase. क्योंकि generally water किस पे boil होता है 100 डिग्री सेल्सियस टेम्परेचर पे. लेकिन अपनों ने क्या किया कि in the autoclave what we did is that we are actually first we are evacuating the air that is present, a vacuum is created, then we are actually heating the water and atmospheric pressure will rise. Therefore, the pressure at which the water will boil will also rise. And therefore, it has three phases. That is, one is the conditioning phase in which the vacuum is created. The next phase was the exposure phase. We start boiling the water, and the exhaust phase when the desired temperature has rise, that is about 121 degrees Celsius at 15 psi. Okay, and we actually boil for the 15 minutes. The 15 minutes is the holding time for the autoclave. So when we have achieved the desired temperature and the pressure, the exhaust phase will start, because we will open the safety valves to eliminate the rest of the pressure and the steam through the safety valves. Now what is the cycle duration? Generally, this is the standard procedure that we use to boil at 121 for 15 minutes at 15 psi. But the cycle may vary from 3 to 18 minutes, and the temperature may vary from 121 to 135 degrees Celsius at 15 psi. But when we use the temperature at 134 degrees Celsius, the pressure will obviously increase. This will increase to 30 psi. Okay. Although the question is generally asked from this, what is the temperature, that is 121 degrees Celsius temperature for 15 minutes at the pressure psi. But when we increase the temperature to 134, the psi, the pressure, that will be 30 minutes, and the cycle will be of 3 minutes. Now autoclave कितने तरीके के होते हैं? We read about it is generally of horizontal and the vertical. और horizontal क्या होता है? Horizontal is the bigger autoclave that we use, and where we use mainly we use for the this biomedical waste management, and we use for the large laboratories and large hospitals. And next is the vertical. Now vertical is what the small autoclave at the smaller scale we use, and for the small laboratories we use. For the biomedical waste management and for the large area, we use the horizontal autoclave, and for vertical autoclave, we use for the small laboratories. Now, what is the advantage? Advantage, it is used for all critical and the semi-critical instruments. We use autoclave, and for all the culture medias that we are using the autoclave, but not for those culture medias containing the oil, grease, right? And we do not use for the glove powder, and we do not use for LG media and Loeffler slope media. इनके लिए अपन क्या यूज करते हैं? Incipation. Remember this. Okay, that we are using what the incipation, very important to remember, because we are using for the LG media and the Loeffler slope media. Other than this advantage, it is that it is low cost and cycle duration are the fast, plus there is no bioproduct that is remaining at the end, because when we see about the ethylene oxide that we are using for the fumigation, bioproduct remains, therefore we have to do the aeration for the 8 hours, so cycle की duration ही बढ़ जाती है for the sterilization, therefore it is fast, it is low cost, and there is no bioproduct. But what is the disadvantage? Disadvantage is we cannot use for the oil and the grease and the glove powder as well as the algae media and Loeffler syrup media. इसके अलावा that is the moisture, since it is a moist heat technique, it may also cause the electronic damage to the instruments, as well as the heat can damage, the access of the heat can damage what the instrument, can do the corrosion and can damage the acrylic and the styrene containing. Now, important is to remember the controls. Now, controls are very important. The first is the biological control. Biological control, we know that is what very famous, that is the Geobacillus Theothermophilus. Okay, and the chemical indicator that we are using, it is what the brownies green tube. It is generally what the red color, but complete disinfection has been done, so the tube will turn what? Green. Scale of physical indicators, that is the temperature, pressure, and the time, they are already controlled by the autoclave, because autoclave has the pressure controlling valve and temperature controlling. By the thermocouples, it is already controlled. Okay, so what is the most important to remember is the biological indicator concept, Geobacillus Theothermophilus, and it is also the indicator for the plasma sterilization as well. And the brownies a green tube, that is changes from the red to green tube once the disinfection has been complete. Now another is what? Another is the flash sterilization. Another what? The flash sterilization. Now flash sterilization is nothing but it is what? It is a modification of what? It is a modification of the steam sterilizer. It is nothing but it is what? A modification of the steam sterilizer, and it is used for the emergencies during unplanned surgeries. And what happens, the flash sterilization is nothing but the modification of the autoclave. तो क्या होता है, जब ऑपरेशन थिएटर के पास ही होता है flash sterilization, and for the unplanned emergencies, unplanned operations, the flash sterilization is used and the temperature is used because it is a flash. तो अपन higher temperature use, flash मतलब एक बार में, मतलब जैसे how does a flash appear? For the seconds it appears, for minutes. ठीक है, तो it is 134 degrees Celsius for 3 to 10 minutes that we are using. And what is the key that we have to remember here, कि flash sterilization में we are using the unwrapped condition, unwrapped implements and the devices, because we need to sterilize as fast as we can, because it is an unplanned emergencies, unplanned surgeries, and unwrapped implants, we are actually keeping it inside the flash sterilization machine, and it will to sterilize the instruments. Now, it is not used for porous material because they will be damaged, or the cannulated materials, right? And what is the disadvantage? That the risk of contamination is high risk of contamination. Why? Because unwrapped condition may we are actually sterilizing the these instruments, and soon we take out because it's these unwrapped conditions we are using. So high risk of contamination. And another key point is to remember that it is used for the emergencies and for the unplanned operations. So we are done with the steam sterilizers, that is the autoclave, and another is the flash sterilization. And next is what the ethylene oxide. Okay. Now, ethylene oxide is a chemical gas that is being used, and it is although used in concentration up to 3 to 10%, but पूरा ethylene oxide हम gas नहीं use कर सकते because it is carcinogenic, it is irritant to eyes, and it may even cause the asthma. ठीक है, तो 3 to 10% अपन use करते हैं with the inert gases. So inert get a gaseous chemical that is used, and it is used along with the inert gases that we are using, that is up to 3 to 10% we are using. And one thing that we have to remember is that how does the ethylene oxide works? It works by the alkylation of the cell component. That is 3 to 10% अपन use कर रहे हैं, important to remember. And another, it what does it do? It does the alkylation of the cell component. But preconditioning vacuum is created because it is used for the fumigation, and it is very obvious that किसी भी रूम को fumigate करने के लिए पहले वैक्यूम क्रिएट करेंगे, फिर इथाइलिन ऑक्साइड दैट विल स्प्रे द इथाइलिन ऑक्साइड इन द गैसियस फॉर्म. ठीक है. Now there are four parameters to see the effectivity of any fumigation by the ethylene oxide. पहले तो that is the gas concentration, how much we are using, and at what temperature we are using, and what is the relative humidity. क्योंकि relative humidity very important for the maintenance, for the disinfection effectivity of the ethylene oxide, and is the exposure time. So these all are important to see the effectivity of the ethylene oxide, and the relative humidity is very important. Now what happens that sterilization is achieved in 4 to 5 hours at 38 degrees Celsius, and in 1 hour at 55 degrees Celsius. Okay. But what is the key point here is that ki although the sterilization has been achieved at 4 to 5 hours and in 1 hour at 55 degrees Celsius, still it is not considered as sterilized. क्योंकि अपन अब जो ethylene gas अपना जो use किया, since it is carcinogenic irritant, once the fumigation has been done of the operation theater, we need to do the aeration as well. और aeration को अपन को कम से कम 8 से 12 घंटे के लिए करना पड़ता, तब तक उस रूम में कोई नहीं जा सकता. Therefore the cycle duration increases. Since the cycle duration increase हो गई और ये महंगा भी होता है, therefore it is very less used. Now aeration is done, aeration or degassing, that is done for about 8 to 12 hours to remove the rest of the ethylene oxide that is present on the instruments. Now one thing that we have to remember is that ethylene oxide, that is relative humidity, next its aeration is about from 8 to 12 hours, and it is used for the disinfection of the हार्ट लंग मशीन्स. जितनी बड़ी बड़ी मशीनें होते हैं जिनको अपन यहाँ से वहां लेके नहीं जा सकते, पोर्टेबल नहीं है, वो सब इथाइलिन ऑक्साइड में आ जाएंगे. दैट इज द, क्योंकि अपन ऑपरेशन थिएटर को फ्यूमिगेट करें, उसमें जितनी भी मशीन है दैट विल ऑटोमेटिकली बी डिसइंफेक्टेड. सो हार्ट लंग मशीन्स, रेस्पिरेटर्स, डेंटल इक्विपमेंट्स. ठीक है. So these are, and most important is the heart lung machine. Please remember it by heart, that is heart lung machine. Now what is the advantage? Advantage ये है कि it is able to disinfectant at large capacity. ठीक है. Suitable for the heat sensitive materials, क्योंकि autoclave was what when the temperature was very high, therefore जो अपन rubber की materials है that वो cannot be used, and because they are heat sensitive, so we can actually sterilize it by the ETO. And next is that they are non-corrosive, because moist heat is corrosive, because just moist present causes a corrosion of the instruments, and it has high penetration. Now these are the advantage, but what are the disadvantage? It is that it is highly inflammable gas. And disadvantage, we have to remember that it is highly inflammable. Next is that is of high cost. Okay, and it is of the duration of the cycle is very long, that is around 12 to 14 hours, क्योंकि 12 to 14 hours, because 8 to 12 hours तो aeration में लग गए, rest 4 to 5 hours will takes in the procedure. ठीक है, and it is what the carcinogenic and irritant to eye. ठीक है, डिसएडवांटेज इज इंपॉर्टेंट टू रिमेंबर क्योंकि हाईली इन्फ्लेमेबल है, इरिटेंट टू आई, कार्सिनोजेनिक है, therefore we actually do not use ETO as such until, and whenever it is used the aeration needs to be done for about 8 to 12 hours, therefore the cycle duration is very long. ठीक है, and what is the biological indicator that we are using for ETO as well? It is Bacillus atrophius. ठीक है, it is a Bacillus atrophius and the Bacillus globigi. Okay, Bacillus atrophius is also used as a biological indicator for what? It is also used biological indicator for the hot air oven also. Okay, so remember this. Now coming to the next is the plasma sterilizer. Now plasma sterilization is actually a gaseous state of ions and photons that we are using, right? First, similarly, a vacuum is created and we are using what? The hydrogen peroxide in the concentration of 6 milligram per liter. Now plasma sterilization advantage is that it is low temperature maintained and electrical field is created to create the gas plasma. Okay, so that the H2O2 breaks down into hydroxyl ions and hydroperoxyl ions. Now byproduct is oxygen and water vapor. And what is the cycle duration? It is about 75 minutes. And what is the indicator? Indicator we've already discussed, that is the Bacillus stereothermophilus. ठीक है, ठीक है, तो प्लाज्मा स्टेरिलाइजर की अपन बात करते हैं तो कुछ नहीं होता इसमें, अपन वी आर एक्चुअली क्रिएटिंग अ फील्ड ऑफ द आयंस एंड द फोटॉन्स बाय ब्रेकिंग डाउन ऑफ द H2O2 इन द प्रेजेंस ऑफ द इलेक्ट्रिक फील्ड, ताकि H2O2 टूट के आयंस में कन्वर्ट हो जाए, एंड दीज आयंस विल कॉज द स्टेरिलाइजेशन एंड द बाय प्रोडक्ट आर नॉन हार्मफुल, एंड द indicator that we have to remember is the Bacillus stereothermophilus. This is the same indicator we are using for the autoclave. Now coming to the next, that is dry heat sterilizer. ड्राई हीट स्टेरिलाइजर में कौन आएगा? अपना हॉट एयर ओवन. ठीक है, नाउ हॉट एयर ओवन it is used for the glasswares, powder and the petroleum and the sharp instruments. Now what happens that कि hot air oven में क्या होता है, अपन chamber को electrically heat कर देते हैं and a fan is present in the inside the hot air oven, so that the constantly uniformly the heat is equally distributed into the chamber. ठीक है, now we have to remember the temperatures, that is 170 degree, 160 degree and the 150 degree. That is 170 degree for 1 hour, 160 degree for 2 hour and 150 degree for the 150 minutes, that is the 2.5 hour. So this we can, how this we can remember कि 1 घंटा 2 घंटा 2.5 घंटा, whenever we increase the decrease the temperature, the time will increase. Is obvious क्योंकि temperature decrease कर रहे हो, time will increase. So this is the temperature. Now what is the advantage is that ये क्या होता है, non toxic होता है, low cost, penetration is high and the non corrosive. Disadvantage is that ki high temperature is not suitable for everything now, and the spores that we have already seen is what the Bacillus atrophius, and Bacillus atrophius we were also using for the ethylene oxide. के अलावा Clostridium tetani spores are also used. That is, the Clostridium tetani spores are also used. And Bacillus atrophius ethylene oxide के लिए भी अपन यूज कर रहे थे, ड्राई हीट के लिए भी यूज कर रहे हैं, ऑटोक्लेव के लिए अपन जियोबैसिलस ट्यूथर्मोफिलस भी यूज कर रहे हैं, एंड प्लाज्मा स्टरलाइजर के लिए भी वही यूज कर रहे हैं. Now next is the filtration. Now filtration is the process of removing microorganisms. तो air filters भी होते हैं, and that water filters that we read in about this PSM. Now filters are of two types. One is the depth filters and the membrane filters. Okay. Now depth filters is that they actually retain particle throughout the surface, while it is retained on the surface only. Now, when we talk about the air filters, that we have to remember is that one is the surgical mask. Next is what the HEPA filters and the ALPA filters. Now, HEPA filters and the ALPA filters. The HEPA filters will have the efficiency of filtering up to 99.97, जबकि alpha filtration up to 999% of the filtration. ठीक है. Now it is a ultra low particulate air filtration and it is high effective particulate air filtration. ठीक है. तो ultra low alpha will filter up to 99.99 and the HEPA up to 99.97 filtration. And what is the control that we have to remember? Control is what the Prevendiminase, Dimineta and Serratia. So remember the biological indicators, the controls, that is the Dimineta and the Serratia. And one filter that is no more used is SITS filter, because since it is carcinogenic, so it is no more used. So remember HEPA alpha filters, HEPA 99.97 and the alpha 99.99. Dimineta and Serratia are the controls, and the SITS filter is no more used now because it is what? It is carcinogenic. Now next is the radiation. Now radiation is what? Actually two types, that is the ionizing and the non-ionizing. ठीक है. तो जो अपन बात करते हैं आयोनाइजिंग के रेडिएशन की, वी टॉकिंग अबाउट द एक्स-रेज and the gamma rays, that we are talking about the cobalt 60 gamma rays. And now when we talk about the non-ionizing radiation, that is infrared radiation and UV radiations. Now, what is the difference is that the ionizing radiation is also called as the cold sterilization technique. Please remember this. It is also called as the cold sterilization technique because the temperature is not increased. The temperature is not increased in this ionizing radiation, while no ionizing radiation is actually hot sterilization. So remember this कि ionizing and non-ionizing. Ionizing में X-ray, gamma rays and cobalt 60 gamma rays we are generally using. For the non-ionizing, it is infrared and the UV rays. Now, जब अपन बात करते हैं रेडिएशन के एडवांटेज इज सेम, दैट इज द हाई पेनिट्रेशन, रैपिड एक्शन एंड low temperature is being maintained in the ionizing radiation. Now, but the disadvantage that it is high cost. Now, what is the sterilization control we are using here? We have to remember is what the Bacillus humulus. Okay, that is a bacillus pumilus. We are using the control for the cold sterilization, and we need to remember. But we also, the where we are using this, we are using for the cat gut suture. We need to remember cat gut suture, and for the dressing materials, for the antibiotics, and from the for the pre-packed syringes. Please remember, one is the catgut suture because mostly all the sutures are being sterilized in the autoclave apart from the catgut. So catgut sutures, antibiotics, dressing materials, and the pre-packed syringes. And non-ionizing radiation is mainly used for the OT fumigation. OT fumigation के लिए अपन एक तो अपन क्या यूज कर रहे थे, वन वाज द इथाइलिन ऑक्साइड. इसके अलावा विल रेड आगे कि एल्डिहाइड्स वी आल्सो यूज फॉर द OT fumigation, right? One we read about the microwave. Microwave is similar to that of the that we're using the kitchen, but one thing we have to remember is that the radio frequency that we are using of the wave is 250 megahertz. That is 250 megahertz radio frequency we are using for the microwave. It is used for the soft contact lens and the dental instruments and the urinary catheters to sterilize them. Now this was about the sterilization. Now we'll talk about what. And one is the incineration that we're using in the hot technique also. So incineration, 80 to 85% of the product is reduced to what? Reduced to ashes. And the temperature is generally what? The temperature is about 700 to 800 or 1000 to 1100 temperature that we are using for the incineration and mainly used for the biomedical waste management. Now next is what? High level disinfectant. We read about the three levels of the disinfectant: high level, intermediate, and the low level. The first we'll talk about the high level, and that is we are talk about the aldehydes. ठीक है, और aldehydes में सबसे पहले अपन बात करेंगे glutaraldehyde. And please remember that all the type of endoscope, cystoscope, bronchoscope, जितने भी scopes हैं, this will be disinfected by what? The glutaraldehyde. Okay, and what is the advantage of the glutaraldehyde is that they also retain their activity. We read about the phenol and the glutaraldehyde, they retain their activity even in the organic matter. ठीक है, the organic matter will not hamper the activity of the glutaraldehyde. And one is the Sidex that we have to remember. The concentration is 2 to 2.4% for the glutaraldehyde in the Sidex. And important thing to remember is that Sidex the concentration, and glutaraldehyde also works by the alkalization of the cell components. So remember, जितने भी तरह के scopes हैं that are what inactivated by the glutaraldehyde, organic matter will not hamper the activity of the glutaraldehyde, and Sidex is having 2 to 2.5% for concentration of the glutaraldehyde, and it is also used along with the other gaseous forms to for the OT fumigations, right? And one important thing is that it is activated by alkalization because it is inactivated form, so alkalization before use. ठीक है, प्लीज रिमेंबर दिस कि ग्लूटाल्डिहाइड किसके लिए यूज होता है, साइडिक्स में क्या कॉन्सेंट्रेशन होता है, ऑर्गेनिक मैटर विल नॉट हैम्पर द एक्टिविटी ऑफ फिनॉल्स एंड द ग्लूटाल्डिहाइड. एंड अनदर थिंग इज दैट इट इज एक्टिवेटेड बाय द एल्कलाइजेशन बिकॉज प्री यूज से पहले अपन को यूज से पहले एल्कलाइजेशन करना जरूरी है. बट व्हाट इज द डिसएडवांटेज इज दैट कि इसका पंजेंट ऑर्डर है. इट इज व्हाट? इरिटेंट टू आई. Irritant to what? Irritant to eye. Sorry for the little disturbance in between. There's so much going on in the house right now. Okay, so क्या होगा कि high level disinfectant this will actually having the pungent odor and is what irritant to eye. ठीक है तो it is used for the cleaning of the OT. We have seen that is disadvantage. We have seen कि pungent odor है, irritant to eye है, and is causing the asthma as well. Now coming to the next, that is the orthophthaldehyde. That is another form of the aldehyde that we are using, but it is better than the glutaraldehyde क्योंकि it is having a better odor, pungent smell भी इसकी कम है, and it acts faster and it causing the less eye irritation. This is all we have to remember about this. Not so important. Next is what the formaldehyde. This is important to remember. That first is thing is that it is of limited use. What is the reason that it is of limited use? क्योंकि एक तो it is also having what the irritation to eye and the pungent odor. ठीक है एंड व्हाट इज द फॉर्मल्डिहाइड व्हाई इट इज सो लिमिटेड टू यूज क्योंकि क्या होता है फॉर्मल्डिहाइड इज व्हाट हैविंग द कार्सिनोजेनिक एक्टिविटी राइट एंड आल्सो कॉजिंग द कोरोजन एंड इरिटेशन टू द स्किन एंड टू द आई देखो फॉर्मल्डिहाइड को अपन ए सेप्सिस के लिए यूज कर ही नहीं सकते दैट इज फॉर द लिविंग टिश्यू वी कैन नॉट यूज द फॉर्मल्डिहाइड एंड देयरफॉर इट इज लिमिटेड टू नॉन पेशेंट केयर ओनली ठीक है it is limited to non-patient care only and it is we know that in anatomy that we preserve the this specimen through the formaldehyde so therefore it is used for the anatomical specimen preservation and it is no more used for fumigation. What is the reason? As I have told you, it is a potential carcinogenic. Therefore, formaldehyde is no more used for the fumigation of the operation theaters. Now, coming next is to the para-acetic acid. Whatever we are talking about right now are the high level of the disinfectant. So we'll talk about the para-acetic acid that is used for mainly for the automated machines in the concentration of 0.1 to 2%, 0.2% for 5 to 15 minutes. Right, and what we have to remember इसका जो चीज एक चीज अपन को याद रखनी है that para-acetic acid is used in combination of the H2O2 बस ठीक है ब्रूटाल्डिहाइड का वी हैव टू रिमेंबर दैट फॉर ऑल द एंडोस्कोप्स एंड जितने भी स्कोप्स है उसके लिए अपन यूज कर रहे हैं अदर देन फ्यूमिगेशन के लिए अपन यूज कर रहे हैं साइडेक्स में 2% अपन को यूज करना होता है फॉर्मल्डिहाइड को वी आर नो मोर यूजिंग बिकॉज इट इज पोटेंशियल कार्सिनोजेनिक right and H parasitic are using in combination of the H2O2. Now next is the hydrogen peroxide that we are talking about the H2O2. This is very important to remember क्योंकि कि हमने बात की थी कि जब हाई लेवल ऑफ डिसइंफेक्टेंट को अपन ऑप्टिमम लेवल पे यूज करते हैं दे विल शो द कार्सिनोजेनिक एक्टिविटी सो इट इज पॉरिसाइडल at what level at more than 4 to 5 level of concentration and fogging के लिए भी अपन यूज कर रहे थे and fogging के लिए क्या concentration है 3% for the soft contact lens and the endoscope it is about 3 to 6% एंड अपन इसको प्लाज्मा स्टरलाइजेशन में यूज कर रहे थे बिकॉज वी वर क्रिएटिंग इलेक्ट्रॉनिक फील्ड जिसमें H2O2 को तोड़ रहे थे तो वहां पे वी हैव टू रिमेंबर इज 6 to 7.5%. जस्ट रिमेंबर टू मोस्ट इंपॉर्टेंट इवन इफ नॉट पॉसिबल टू रिमेंबर द ऑल कि स्पोरिसाइडल के लिए कॉन्सेंट्रेशन कम से कम 4 होना चाहिए और फ्यूमिगेशन के लिए कम से कम 6 होना चाहिए दिस वी हैव टू रिमेंबर एडवांटेज इज दैट इट इज रैपिड एंड इट इज नॉन टॉक्सिक बट डिसएडवांटेज इट इज एक्सपेंसिव. Now, this was about a high level of the disinfectant that we were talking about. Now, we'll talk about the intermediate level of the disinfectant. Now we'll talk about what the intermediate level of the disinfectant, that is intermediate. तो इसमें सबसे पहले अपन बात करेंगे अल्कोहल. That is alcohol when used for the alcohol based hand rub. ठीक है, that is what is the name, brand name, that is the sterilium that we use for the alcohol based hand rub, and for the disinfections of the stethoscope and for the external surfaces also we use. ठीक है, and in the spirit that we are using in the hospital, the concentration is about 70% in the spirit that we are using for the skin asepsis. Now coming to the disadvantage is that it is flammable. ठीक है, it is flammable and evaporative and is inhibited by the organic matter. Organic matter में we always have to remember only 2 points, that it is the alcohol, phenol and the glutaldehyde that is not inactivated by the organic matter. Rest are all inactivated by the organic matter. Now next is about phenol. Now phenol is what? It is a protoplasmic poison. That is, it will disrupt the cell wall. ठीक है, अब इसमें अपन को क्या चीज याद रखनी है फिनॉल में. अल्कोहल में अपन को एक तो याद रखेंगे स्पिरिट इज अबाउट 70% ऑफ द अल्कोहल. दिस इज इट वी हैव टू रिमेंबर इन द अल्कोहल. बट व्हेन वी टॉक अबाउट द फिनॉल्स में एक दो चीजें याद रखनी. एक तो इट इज नॉट इनएक्टिवेटेड बाय द ऑर्गेनिक मैटर just like glutaldehyde, and another thing is that we have to remember is the cresol and the lysol. Yeah, now cresol and the Lysol that are using for the disinfection of the bed sheets and the hospitals curtains and the bed sheets. But although cresol and the Lysol is not used for the skin asepsis because they are toxic, because the phenol concentration is high in presence of the cresol and the Lysol. Just remember it, it is not used for the skin. But certain phenols that are used for the skin, that is the Dettol एंड द सेवलॉन. वी नो दिस. इसके अंदर क्या होता है? डेटॉल के अंदर होता है क्लोरोहेक्सिनॉल एंड क्लोरहेक्सीन. Okay, so we have to remember कि phenols, they are not inactivated by the organic matter, and the two, that is cresol and the Lysol. Cresol and Lysol mainly used for the disinfection of the surfaces and the bed sheet and the curtains, but they are not used for the skin because phenol is toxic to skin. लेकिन कुछ asepsis के लिए use करते हैं, जैसे कि Dettol and Savlon that we are using in the market name, and it is important to remember Dettol is having chlorhexidine and Savlon chlorhexidine. Disadvantage of phenols is important to remember. The disadvantage is that if we use in the infant, it will cause the hyperbilirubinemia in infant. Because we have to remember that for hyperbilirubinemia, it is not may cause the hyperbilirubinemia in the infants, therefore not used in that cases. Okay, alcohol we talked about the alcohol. Phenols also we have talked about कि phenols में जब अपन को एक ही चीज याद रखनी है, that is the cresol and the Lysol, because they are used for the bedside and tables, and one is that they are used in the antisepsis, one is the Dettol and another is the Savlon. ठीक है, I'll not cover up the whole slides because it will take too much time, and only the important points will be covered in the rest of the slides. So don't worry कि बहुत सारा वापस पढ़ा रही हूँ, only the important things will be covered. Advantage we have seen, one important advantage is that they retain activity in the presence of the organic matter, just like the glutaraldehyde. Okay. Now moving next is the halogens. In halogens we have two important halogens. One is the iodine and the chlorine. And iodine mainly it is the tincture of iodine, and chlorine is the hypochlorite and the hyperchlorous acid. So hypochlorite is important to remember. It is a sodium hypochlorite in the concentration of 1% that is used for cleaning of the blood spills. Okay, so tincture of iodine is the presence of the tincture or preparation of iodine, potassium iodide, and another is the iodine is the tincture of iodine and the povidone iodine that we are using. Because why we using the povidone iodine? Because iodine causes the staining of the skin. So povidone iodine is prepared by which helps in the sustained release of the iodine and will it is free of skin toxicity and the causes non-staining. Okay, and betadine and vascodines are the market names for this. Now, coming used as the antiseptics, when we talk about the iodine that we are using, that one is remember that for the 1%, 5%, 7.5 and the 10%. Okay, so 1% is used for the mouthwash. 5% is used in the ointment form, that for the povidone iodine we are using 7.5% in the hand rub and 10% for the surgical skin preparation. One is remember the povidone iodine that we are using 5% concentration, and for the mouthwash we are using 1%. Now chlorine, roughly chlorine, the hypochlorite we have to remember that दो form में होता है hypochlorite. One is the sodium hypochlorite form, that is the liquid, and another is the powder form. Powder में क्या होगा? Calcium. And sodium hypochlorite is mainly used for clearing out the blood spills in the concentration of the 1% concentration. So remember, this is important to remember. Now, free chlorine is used for the disinfection of the municipal water supplies. We know because PSM we have read this. Sodium hypochlorite we have seen, which is equivalent. Now, concentration we have seen that it is for the large blood spill, it is about 0.5 to 1% concentration. For the generalized, just remember it is for the blood spills we are using 0.5 to 1%. And it is at Clostridium difficile hypochlorous only at 0.5% concentration. Advantage is that they are broad spectrum, and disadvantage we have seen that they are inactivated by the organic matter, they are toxic to the skins, and most important thing is that the hypochlorite they actually evaporates, right? And they evaporates and they are unstable, therefore they are freshly prepared for the use, therefore they are what the unstable and evaporates, right? And since actually this hypochlorous and hypochlorite they are ions, so they will cause the corrosion and leaves the residue, take an offensive odor and bleaches the fabrics. Just remember one key point, that is we have to daily prepare the hypochlorite because they are unstable and evaporates rapidly. Now, heat-based technique, we have already seen the pasteurization at 100 and steaming at 100. UV radiations we have seen, we have studied. Now, coming to the low-level disinfectant. Okay, so we'll talk about the low-level disinfectant. First, we'll talk about the quaternary ammonia compound. That is, quaternary ammonia, they act by the inactivation of the enzymes. Just remember the formulation that we use in the quaternary ammonia compound is the benzyl ammonia chloride. Okay. Now another is the chlorhexidine gluconate. The chlorhexidine we have already seen, we were using chlorhexidine where we were using in what? We are using in the hand rub, and that is the Savlon. Okay, commercially available as the Savlon. Now, cleaning agents, cleaning products, enzymatic cleaners, and the chemicals that we are using. Enzymatic cleaners such as the cellulose, amylase, and that we are using, and they just only remove the proteins from the surface. Chemical, the detergents, that is their soaps that we are using for the cleaning, and cleaning is only the decontamination to a level that it is no more a public harm. Now, first is the manual cleaning by the instrument to the cleaning solution or by wiping the surface, and another is the automatic cleaner, that is the by automatic machines or mechanical cleaning that we are doing. Now, coming to the disinfections of the OT. Now, surface disinfection first. Cleaning should be performed first with the cleansing agent followed by the disinfection. So, first mechanical cleaning is done of the OT and then the agents are used. That is first cleaning of the day before the case begins. And in between the cases, again cleaning is done and terminal cleaning of the OT and detailed wash down of the OT complex. Now, fogging that we have seen, we are using the glutaldehyde, the H2O2 and the quaternary ammonia compounds for the fogging that we are using, and ethylene oxide. Now, it is important to remember the name of the methods of the efficacy of the sterling. Okay, so just remember the names. The names are very important to measure the chemical disinfectant efficacy. One is the Riedel and the Walker test or the phenol coefficient test. Another is the Chick-Martin test. Now, Riedel and the Walker test, it is for the efficacy of the phenol disinfectant to kill the salmonella typhi. Just remember to see the phenol efficacy of disinfection. We use the phenol coefficient test or Riedel Walker test. Next is the Chick-Martin test. Now it is a modification of the Riedel and the Walker test, and it acts in the presence of the organic matter, okay, to stimulate the natural condition. That is, it is intentionally we are providing the organic matter to see the disinfection capability. So one for the phenol, we are using phenol coefficient or Riedel Walker. Next is the Chick Martin. Another is the Calci Siski test, right? And it is a disinfection to retain the activity when the loads keep increasing. Now it is used to test the new disinfectant occurred. Now whenever a new disinfectant is going to come into the market, before the market, to before to see the efficacy to retain its this capacity even in the microbial load when it is increasing. So this is to see by the Kalski Siski test, and another is the in-use calcimore test. That is, it is used to determine whether an in-use solution in hospital is microbiological contaminated or not. So one is we are using for the phenol coefficient test, that's Riedel Walker. Another is the modification, that is a Chick Martin. Another is the Kilski-Siski test that tests the capacity of the this ki how much it can tolerate the microbiological load, and another is the Calci-More test that will see what ki whatever the disinfectant that we are using, it is either already contaminated or not. That is the Calci-More test. Just remember the name of these tests because it is a direct question. The names are direct questions. Now the test for the sterilizers, we've already seen the physical, chemical and the biological indicators. Now in the chemical indicators, we've already seen that Brown's tube that we use. Just remember one name, one is the Brown's tube and the Bobby Dix test that we are using. Biological indicators, we have already seen that geobacillus thermophilus that we are using for what the autoclave and as well as for the plasma sterilization, Bacillus atrophius for ETO, and the hot air oven. For hot air oven, we were also using the closed treatment technique, right? And the pumilus that we're using to see the Bacillus pumilus that we're using to see the gaseous efficiency, that is in the ETO that we're using the Bacillus pumilus. Now coming to the genetics, bacterial genetics. Before starting the bacterial genetics, just a 1 minute break. ठीक है, तो we'll start with the plasmid. Now, plasmid is what? Plasmid is an extra chromosomal DNA circular material that is present inside in the free state in the cytoplasm of the bacteria. So, ये बैक्टीरिया है कि बैक्टीरिया क्या है, प्रोकैरियोट है, एंड इन प्रोकैरियोट विल हैव अ सिंगल सर्कुलर what single circular DNA material that is present in the bacteria. Apart from this, the chromosome that is present in the bacteria. Now, extra chromosomal double circular DNA will be present, and that is present in the free state. Okay, and it is what? It is nothing but plasmid. Now, they may present in single or number that is up to 1 to 40, that in a single bacteria 1 से 40 तक plasmid present हो सकते हैं. And what is key point that is important to remember is that कि plasmid एक तो extra chromosomal DNA material होता है that is present freely in the state, ठीक है. And another key point is that they may be up to 40 numbers and they are capable of replicating independently. ठीक है. Now, episome, sometimes the plasmid may be integrated with the DNA and they are called was the plasmid episomes. Then the plasmid is integrated with the uh, chromosomal DNA that will form what? The episome. Okay, and since they are integrated in the episome in the chromosomal plasma, so they will also replicate with the they will also replicate with what? They will also replicate with bacterial chromosome. Okay. Now coming to the one term that we need to remember is the curing. Curing कुछ नहीं होता, it is eliminating the plasma. Eliminating the plasmid is known as the curing. तो इसको ऐसे याद करो, curing the bacteria by eliminating the plasmid. So it may occur either spontaneously or we can actually induce it, that is by acridine, by using the acridine or the radiation. ठीक है, और growth at the higher temperature. So we can curing is nothing but curing is the process of eliminating the plasmid from the bacteria either by spontaneously it has occurred or by using the high temperature and acridine. Now, based on the conjugation ability, दो तरीके के होते हैं. One is the conjugative plasma and non-conjugative plasma. That is कि conjugative plasma with the help of the conjugation tube, और conjugation tube सिर्फ उन्हीं बैक्टीरिया बनती है जिनके पास ट्रा जीन्स होती है. ठीक है, with the help of the conjugation tube will takes part in the conjugation, that is the horizontal transfer of the this plasmid from one bacteria to another, and another is a non-conjugative, that is all the bacteria will not take part in the conjugation. Based on the compatibility, they can be grouped into the compatible plasmids and incompatible plasmids. ठीक है. Now, when different plasmids, as I told you, up to 1 to 40 plasmids present होते हैं. अगर एक ही बैक्टीरिया में more than one plasmid are present in single bacteria, so they are what? The compatible plasmids, and it is not, then it is incompatible plasmid, because when two plasmids are non-compatible, one will be lost. What is the reason that the plasmids are compatible, incompatible? अगर एक ही बैक्टीरिया में एक से ज्यादा प्लाज्मिड साथ में है तो compatible plasmids होगा, और एक से ज्यादा नहीं है, साथ में नहीं रह पाए, because they are sharing the same process of the replication and there is competition between two, so only one will survive, so that is the incompatible plasmid. Now, based on the functions, that is we will see, one is a fertility plasmid, that F factors that is present is responsible formation of the conjugation tube, and उसके लिए TRA genes होनी बहुत जरूरी, that is the presence of the TRA genes. Another is the resistance plasmid, that is the R plasmids consisting of the R and the RTF, that will read how it is actually causing the resistance. And one is the cold plasmid that is found in the bacteria, that will code for the bacteriocin, that is antibiotic like protein that can also kill the other bacteria, because bacteria having the property of the cold plasmid will secrete what? The bacteriocin in the surrounding and will kill the other competitive bacteria. So it's a method of the survival. So cold plasmid will form the bacteriocin. Now, virulence plasmid. Now, the several toxins that are plasmid mediated. We'll read a list of the plasmid mediated toxins that we have to remember. That is for the E. coli. Examples include the E. coli, that is the heat labile and the heat stable toxin of the E. coli, heat labile and the heat stable toxin of the E. coli. इसके अलावा that is the siderophore production by the E. coli and the adherence antigens, that is K88 plasmid in the E. coli. So E. coli toxins are what? Please remember, very important, that E. coli toxins are what? They are what? Phage mediated, plasmid mediated, that is the heat labile toxin and the heat stable and the iron chelating molecules and the adherence antigens. Now metabolic plasmids also, no need to remember the name. Now plasmid and vector plasmid has the ability to transfer the DNA from one cell to another, and the plasmid contains has a certain sites where genes can be inserted artificial, so they have been used as the vectors. Now gene transfer. When we're talking about the gene transfer, that is the vertical and the horizontal gene transfer. First, we'll talk about the mutation. Now, mutation is a random, undirected, heritable variation. Now, one thing is that whatever the resistance has occurred by the mutation, that is, they are what generally one drug resistance takes place, right? And that too of low resistance will takes place, and that can be overcome by increasing the higher dose of overcome by high dose of antibiotic. ठीक है, these points are important to remember कि जो resistance एक mutation से है, वो resistance एक drug के लिए होता है mostly, and it is of low dose and can be overcome by the high dose. Reverse is possible for the transferable drugs, that takes place by the horizontal transfer, that is the multiple drug resistance will take place, and it is of high dose, and the drug combination we need to give. We do not need to increase the dose. We need to give the combination. Okay, so spontaneous mutation and the induced mutation by the physical and the chemical agents, that is the UV light and the alkylating agents. Now, E. coli mutants that loses its ability to ferment lactose can be readily detected by the Mekonkiana mutation is taking place. They were the unrecognized. Now, one example is what the E. coli. E. coli का हमने देखा ही है. One is the plasmid mediated toxin कैसे काम करता है. Another is that E. coli is what? E. coli ferment glucose, but once the mutations take place, it will lose the ability to ferment lactose and can be seen by the McConkey account. Classification: small scale mutation and the large scale mutation, and the gene detection is by the gene sequencing phenotypic method. And now come to the important topic, that is what the horizontal gene transfer. That is the horizontal gene transfer. First, we'll talk about the transformation, transduction, lysogenic conversion, and what the conjugation. सबसे पहले बात करते हैं ट्रांसफॉर्मेशन. ट्रांसफॉर्मेशन कुछ नहीं है, जब वन बैक्टीरिया loses its DNA content into the surrounding media, this will be taken up by the adjacent bacteria, that is the competent bacteria, because not all the bacteria will take out the DNA content from the environment. Only those bacteria having the competent factors on the surface will only take up the DNA content from the surrounding atmosphere. ठीक है, that is a random uptake of the free or the naked DNA fragment from the surrounding media and incorporation of this DNA fragment into chromosome in an inheritable form. Now, mechanism is that they release the bacteria when they're about to die. They will release the large content of the DNA and the plasmid content into the surrounding media, that will be taken up by the competent bacteria. So this we see that this is the DNA that has been taken up by the DNA fragments that are present in the surrounding, and this will either integrate and form the stable transformation or will not integrate it into its own chromosome. Another is the plasmid is also taken up by the bacteria. Now, competency is important because not all the bacteria will take up the this DNA content that is released in surrounding environment. Only the competent bacteria, because they have certain competent factors that are responsible. Just remember this. Now this is the transformation only, that is the bacteria is going to lyse, releasing its what content, it's the DNA material. This will be taken up by the adjacent bacteria, right? Now, how it was actually demonstrated, this we have to remember, this was demonstrated by a scientist, that is the Griffith, on where, on the pneumococcal strain, where on the pneumococcal strain. Okay, so how he demonstrated that, ki you clearly see the mouse when injected with a smooth strain, that is the that is a virulent strain. So actually the mice died, and when we injected with the R strain, rough strain, that is non-virulent, the mouse remained healthy. But when we injected with the heat killed smooth strain, that cells, that is the mice actually remains healthy. Why? Because heating killed up the bacteria, so the mice was not harmed. But when we give a combination of the living R cells and the heat kill smooth cells, तो जो heat kill smooth cells ने अपना क्या किया, अपना DNA content छोड़ा, that was taken up by the rough cells, and the rough strains converted themselves into virulent strain, and they actually killed the mice. So this is that when injected with the mixture of the live non-encapsulated with the heat kill capsulated, the mice actually died. So remember the stain on which the Griffith experiment was done. It was done where, on the pneumococci strains. So now next is what the transduction. Now transduction is what, it is the transmission of the DNA from one bacteria to another by what? By bacteriophage. ठीक है, बैक्टीरियोफेज नथिंग इज वायरस दैट मल्टीप्लाइज इनसाइड द बैक्टीरिया. ठीक है, तो ट्रांसडक्शन इज हॉरिजॉन्टल ट्रांसफर ऑफ द दिस जीन फ्रॉम वन बैक्टीरिया टू अनदर विद द हेल्प ऑफ द बैक्टीरियोफेज, एंड इट इज एन एरर डिफेक्ट बिकॉज जनरली इट शुड नॉट बी प्रेजेंट. ठीक है, एंड बैक्टीरियोफेज इज नथिंग बट अ वायरस दैट नीड्स अ बैक्टीरिया एंड अ होस्ट टू replicate. Now mechanism: during the transfer of the bacteriophage from one bacteria to another, a part of the host DNA may accidentally get incorporated. As I told, it is defective. Generally, it should not happen. This leads to the new characters by the recipient bacteria. Now, bacteriophage performs two cycles. One is the lytic and another is the lysogenic. Okay, from the name, lytic is what? The virulent virulent cycle, and the lysogenic is what? The temperate cycle. ठीक है, तो अब इसको कैसे समझेंगे? देखो इस डायग्राम, इट एवरीथिंग इज क्लियर फ्रॉम दिस स्लाइड ओनली कि लाइटिक फेज का है, वायोलेंट फेज है, मतलब कि इसमें लाइसिस हो रहा है. किसका लाइसिस हो रहा है? होस्ट बैक्टीरिया का लाइसिस हो रहा है. कौन करेगा? बैक्टीरियोफेज. कैसे करेगा? दैट दिस इज व्हाट, दिस इज अ नॉर्मल बैक्टीरिया दैट phage has been infecting. ठीक है, now phage DNA insert itself into the bacterial chromosome. Now this phage DNA, the fragments of the phage DNA and the it will break down the fragments of the bacterial chromosome. ठीक है, तो क्रोमोसोम के जो बैक्टीरिया के क्रोमोसोम में डीएनए फ्रेगमेंट्स भी फ्रीली प्रेजेंट है और बैक्टीरियोफेज के भी. सो व्हाट विल हैपन कि बैक्टीरियोफेज विल फॉर्म इज डॉटर वीरियंस. ठीक है, एंड एक्सीडेंटली इटसेल्फ विल इनकॉर्पोरेट इटसेल्फ द क्रोमोसोम ऑफ द बैक्टीरिया. ठीक है, तो कुछ नहीं है, जब खुद अपना हेड बनाएगा, बच्चों का हेड सरफेस बनाएगा, तो उसके साथ बैक्टीरियल क्रोमोसोम को भी साथ में ले जाएगा. तो दिस विल कॉज द फॉर्मेशन ऑफ द डॉटर वीरियंस दैट हैज टेकन डाउन ऑफ द क्रोमोसोम ऑफ द बैक्टीरिया. ठीक है, एंड these bacteriophage, that daughter virions, will release after the budding lysis of the bacteria, and these bacteriophage, when again reinfect the another host bacteria, will transfer the DNA content from the last host bacteria to the next host bacteria. So this is a lytic phase. ठीक है, बट समटाइम्स व्हाट हैपन्स कि क्या होता है कि बैक्टीरियोफेज का जो डीएनए दैट हैज बीन अटैच्ड विद द बैक्टीरियल डीएनए, दिस विल नॉट कन्वर्ट टू द लाइटिक साइकिल. इट विल गेट इनकॉर्पोरेटेड एंड रिमेन इनकॉर्पोरेटेड एंड विल फर्दर डिवाइड विद द रेप्लिकेशन ऑफ द बैक्टीरियल क्रोमोसोम्स. तो बैक्टीरिया के साथ साथ रेप्लिकेट करेगा, बैक्टीरिया के साथ साथ उसके डॉटर सेल्स को जाके ट्रांसफर हो जाएगा. तो दिस इज लाइसोजेनिक कन्वर्जन ऑफ द बैक्टीरिया, एंड द it is the prophage, that is the attachment of the bacterial DNA with the bacterial chromosome, that this is the prophage. ठीक है। बट कई बार क्या होता है कि लाइसोजेनिक सेल जो अपनी बनी है इट में गेट कन्वर्टेड टू द लाइटिक साइकिल एज वेल, क्योंकि बैक्टीरिया का जो डीएनए है जो बैक्टीरियोफेज के डीएनए के साथ अटैच है, तो वायरस का डीएनए बोलेगा ना नाउ आई वांट टू गेट सेपरेट। अगर वो सेपरेट हो गया तो ये भी डॉटर वीरियंस बनाएगा लाइटिक साइकिल के साथ एंड बडिंग लाइसिस ऑफ द बैक्टीरिया विल टेक्स प्लेस। सो वेरी इंपॉर्टेंट एंड वेरी इजी कि लाइटिक में कुछ नहीं हो रहा, लाइसिस हो रहा है और साथ में डीएनए कंटेंट भी ले गया बैक्टीरिया का। लाइसोजेनिक में क्या हो रहा है, लाइसिस नहीं हो रहा है और डीएनए कंटेंट दोनों के अटैच और साथ साथ में रेप्लिकेट कर रहे हैं और उसके प्रोजेनी और बाइनरी फिजन से आगे डॉटर डॉटर सेल्स को ट्रांसफर हो रहे हैं। बट लाइसोजेनिक साइकिल हैज द कैपेबिलिटी ऑफ कन्वर्टिंग टू द लाइटिक साइकिल डिपेंडिंग कि बैक्टीरियोफेज का मूड है कि मेरे को अब अलग होना है, तो दैट विल कन्वर्ट टू द लाइटिक साइकिल। So this was about the lytic and the lysogenic template cycle that we have seen that in the lytic cycle, bacteriophage multiplies in the host and produces a large number of the progeny, and lysogenic, that is in contrast to virulent, here the host bacterium is unharmed and is integrated with the bacterial chromosome as the prophage. Now coming to the टाइप ऑफ द ट्रांसडक्शन। अब ट्रांसडक्शन भी कैसे टाइप के, जनरलाइज्ड है या फिर क्या है, रेस्ट्रिक्टेड है ना। जनरली जनरलाइज्ड क्या होगा, जनरलाइज्ड का मतलब ये है कि उसने कोई भी डीएनए फ्रेगमेंट्स है बैक्टीरिया की वो उठा लिए, मतलब जनरलाइज्ड क्योंकि बाइसिस के बिना, दैट इज इट इन्वॉल्व्स द ट्रांसफर ऑफ एनी पार्ट ऑफ द बैक्टीरियल जीनोम टू द रेसिपिएंट बैक्टीरिया एंड इट यूजुअली अकर्स एज अ डिफेक्टिव। और मोस्टली किसमें होगा, लाइटिक। इजी टू अंडरस्टैंड क्योंकि लाइटिक साइकिल में क्या हो रहा था कि जो डॉक्टर वीरियंस है उन्होंने कोई भी फ्रेगमेंट उठा लिया, तो यहाँ पे अपना जनरलाइज ट्रांजेक्शन होगा मोस्टली, दैट इज सम मोस्टली इन द लाइटिक, समटाइम्स मे बी इन द टेम्पलेट एंड इट इज व्हाट, इट इज अ डिफेक्टिव, इट इज व्हाट, a defective assembly. This results called the transducing phase often injects the donor and initiate donor does not initiate the light cycle, क्योंकि अब इसमें क्या होगा कि generalized वाले transduction में generally what will happen, the DNA that was taken by the bacteria host bacteria when transferred, तो बैक्टीरिया फेज का खुद का डीएनए इट हैज बीन डिफेक्टिव, कुछ और भी उसमें आके ऐड हो गया, तो इट विल नॉट कॉज द लाइटिक साइकिल इन द नेक्स्ट बैक्टीरिया। Now another is that we are talking, this is about the generalized, easy to remember, लाइटिक साइकिल में ही जनरलाइज हो रहा है, वो याद रह गया तो आपको याद रह जाएगा कि कोई भी फ्रेगमेंट उठा लिया एंड डिफेक्टिव असेंबली इट इज ट्रांसफर टू द नेक्स्ट बैक्टीरिया। अनदर इज व्हाट, द रिस्ट्रिक्टेड और स्पेशलाइज्ड ट्रांसडक्शन। ठीक है, स्पेशलाइज्ड ट्रांसडक्शन रेस्ट्रिक्ट मतलब कि पर्टिकुलर फ्रेगमेंट ऑफ द डीएनए हैज बीन टेकन बाय दैट डॉटर वेरिएंट्स, और ये किसमें होगा, ये लाइसोजेनिक में। इट इज आल्सो इजी टू अंडरस्टैंड क्योंकि क्या होता है लाइसोजेनिक में प्रोफेज डीएनए होता है, मतलब कि बैक्टीरिया का डीएनए है और बैक्टीरियोफेज का डीएनए इनकॉर्पोरेटेड होता है हमेशा साथ में। अब जब बैक्टीरियोफेज का डीएनए बोलेगा मेरे को अलग होना है, तो बैक्टीरिया का डीएनए थोड़ा सा साथ लेके चला जाएगा। ठीक है, सो दिस इज व्हाट अ रेस्ट्रिक्टेड और स्पेशलिटी की पर्टिकुलर एडजेसेंट डीएनए कंटेंट उसने उठाया, सो दिस इज व्हाट द स्पेशलाइज्ड ट्रांसडक्शन एंड दिस हैज बीन सीन इन द लैम्डा फेज ऑफ इकोलाई। ठीक है, दिस हैज बीन सीन इन वेयर, लैम्डा फेज ऑफ इकोलाई। Now, the entire transducing genome does not act as a prophage and get integrates into the recipient chromosome. And what is the role of the transduction is that it will provide the drug resistance and treatment for the various genetic engineering. So nothing to understand, very easy that prophage has been created and साथ में bacteria का adjacent DNA it also takes down with itself and it is transferred to the next bacteria, host bacteria. Now next is what, the lysogenic conversion. Just excuse me for 10 seconds. Okay, now coming next to the lysogenic conversion. Okay, coming next to the lysogenic conversion. So what is lysogenic? We have already studied about the lysogenic conversion. तो लाइसोजेनिक कन्वर्जन कुछ नहीं होता कि जब टेम्परेट और लाइसोजेनिक साइकिल में देखा तो क्या बन रहा था, वहां पे एक प्रोफेज बन रहा था। ठीक है, तो प्रोफेज क्या था कि बैक्टीरियल क्रोमोसोम और बैक्टीरियोफेज का क्रोमोसोम डीएनए फ्रेगमेंट दैट वर गेटिंग अटैच्ड, सो दैट वाज फॉर्मिंग द प्रोफेज, एंड दैट is what the lysogenic conversion. ठीक है, and this process is lysogeny or lysogenic conversion. Now, some important examples that we need to remember are very important are the phage-coded toxins. Okay, and we need to remember this list of the phage-coded toxins can be remembered by that. One is the diphtheria toxins. We remember by mnemonic B, C, D, E. That is what the B for botulism toxin, C for cholera toxin, D for diphtheria toxin, and E for E. coli toxin. Okay, as well as the streptococcal pyogenic exotoxin. So B, C, D, E, and 2. We need to remember this toxin. That is B for what? B for botulism toxin. C for what? Cholera toxin. And D for what? Diphtheria toxin. E for what? Exotoxin. And E for another is the E. coli virocytotoxin. So these are what? These are phage-coded toxins that we need to remember and are very important. Okay, this is the same the lytic and the lysogenic pathway that you have read. So next is what? Conjugation that we'll talk about. What is the conjugation? Okay, so conjugation nothing, it is the transfer of the genetic material from one bacteria to another with the help of the conjugation tube that is formed by the sex pali or the sex tube, and that is formed only in the presence of the TRA genes, and when it is what the when the bacteria is F positive, that is the it is what the donor bacteria or the male bacteria or fertility bacteria, and it when it the conjugation tube is formed and when the plasmid it replicates and the copy is transferred to the F negative bacteria, it will also become the F positive bacteria. So the this formation, this is the when mating of F positive and F negative bacteria takes place, the F negative bacteria will be formed, and it was discovered by the Liederberg and Tatum. Please remember the name of the scientist. It was given by the Liederberg and the Tatum, right? So we have already seen that what it will become, that when F positive, F negative, so bacteria F negative become the F positive, and F negative bacteria is what the recipient bacteria, female bacteria or submissive bacteria. Okay, so this is the same that the sex this conjugation tube formation has take place and the plasmid replication, and the second replicated plasmid will move over to the adjacent bacteria, right? And the F positive bacteria will convert the F negative bacteria to F positive bacteria. Now next is what the HFR, that is the high frequency. Okay, this is the high frequency HFR, and this is what happens कि कई बार क्या होता है कि जो बैक्टीरिया में जो प्लाज्मिड होता है that will get attached with the bacterial chromosomes. ठीक है, so this is the HFR. Now from the name कि it is what HFR, high frequency recombination. So this will happen what कि high frequency से adjacent bacteria के पास जाएगा, ठीक है. बट व्हाट विल हैपन, कितनी हाई फ्रीक्वेंसी जाएगा तो कॉन्जुगेशन विल ब्रेक डाउन एंड द एचएफआर इज नॉट एबल टू ट्रांसफर कंप्लीटली, ओनली अ पार्ट ऑफ द क्रोमोसोम एंड द प्लाज्मिड विल एबल टू ट्रांसफर. सो द एफ पॉजिटिव बैक्टीरिया, दिस एचएफआर will not be able to convert the F negative bacteria to F positive bacteria. So this is the key point that we have to remember, that only the few chromosomal genes along with the part of the plasmid or F factor will be able to go, right, and it is not possible for the complete to go because conjugation tube पहले टूट जाएगी और F negative bacteria F positive में convert नहीं होगा. So this is the key point that we have to remember, that this is what the donor chromosome, and this is the F factor forming the episome, and it will try to go to the adjacent bacteria through a conjugation tube with the high frequency but will not be able to go. ठीक है. So and this is the HFR combination conjugation. Next is what the F dash conjugation. इसको अपने कैसे याद किया जाता है? F dash conjugation का मतलब होता है F factor with dash, that is कि F factor के साथ एक dash भी जाए, that is the chromosomal material, a part of the chromosomal material is going. ये कैसे होता है कि अपने एपिसोम देखा क्या, वही बैक्टीरियल क्रोमोसोम है, and this is the plasmid factor that has been attached. अभी separate होगा, so this will along with it will carry a small part of the bacterial chromosome यहाँ से adjacent. So this is the F dash factor, that is the F factor with the dash, that is dash क्या है, बैक्टीरिया का क्रोमोसोम है, ये पूरा का पूरा ट्रांसफर हो जाएगा एडजेसेंट बैक्टीरिया में रेप्लिकेट होके. सो दिस प्रोसेस इज नथिंग बट व्हाट, सेक्स डक्शन. ठीक है, क्योंकि ये एच एफ आर था, एच एफ आर क्या होता है, रिवर्सिबल होता है, तो जो एच एफ आर थे उससे जब अलग हुआ तो बैक्टीरिया क्रोमोसोम भी साथ ले आया, एंड दिस विल रेप्लिकेट एंड गो अलोंग विद द एफ फैक्टर टू द एडजेसेंट बैक्टीरिया, एंड दिस प्रोसेस इज व्हाट कॉल्ड एज द सेक्स डक्शन. ठीक है, एंड कॉन्जुगेशन विल आल्सो टेक्स पार्ट अ रोल इन द आरटीएफ, एंड आरटीएफ को अपन अभी देखेंगे हाउ डज इट टेक्स पार्ट. Now, role of the conjugation is that the R factor. Now, R factor अकेला नहीं होता. It is what? It is a plasmid that is two components. That is what? A resistance transfer factor and R determinant. ठीक है, तो resistance transfer factor is the plasmid that is able to transfer the plasmid, and the R determinants are what? They are responsible for the antibiotic resistance. ठीक है, तो R factor में जरूर नहीं कि R determinant एक ही हो, it may be more than one R determinants in the single RTF. So factor dissociate, sometimes what happens कि RTF में जो दो component है, this will also be dissociated to RTF, and the R factor will occur exist as separate plasmid. ठीक है, in such cases the resistance will not transfer because R determinant के पास अपनी capability नहीं होती transfer होने की, it will read the resistance transfer factor to move from one bacteria to another. ठीक है, तो इस केस में आरटीएफ तो चला जाएगा एडजेसेंट बैक्टीरिया को, लेकिन आर डिटर्मिनेंट रह जाएगा, तो दिस विल नॉट बी एबल टू गिव द रेजिस्टेंस कैपेबिलिटी टू द एडजेसेंट बैक्टीरिया. ठीक है, तो आर फैक्टर क्या होता है, आर टी एफ प्लस आर डिटर्मिनेंट, एंड इन अ सिंगल प्लाज्मिड मोर देन वन आर डिटर्मिनेंट आर प्रेजेंट फॉर सेवरल एंटीबायोटिक्स. ठीक है, नाउ फेट इज नॉट दैट इंपॉर्टेंट टू रिमेंबर, जस्ट रिमेंबर व्हाट इज ट्रांसपोजिशन, दे आर आल्सो नोन एज अ जंपिंग जीन्स. ठीक है, ये क्या होता है कि खुद के ही एक सिंगल क्रोमोसोम में, खुद के ही एक अपने जेनेटिक मटेरियल में, फ्रॉम वन क्रोमोसोम टू अनदर क्रोमोसोम, एंड फ्रॉम वन प्लाज्मिड टू plasmid, and from chromosome to plasmid, or the vice versa, मतलब अपने chromosome में from one side to another side, plasmid from itself from one side to another side, or from plasmid to chromosome, that the genes are capable of the intracellular transfer. That is, it is what, nothing but an intracellular transfer. This is called the transposition or the jumping genes or the mobile genes. We have already seen it was discovered by the Miss this Barbara McClintock, and she actually discovered the transposons and the role of the transposons. ठीक है, and just remember that they are non-self-replicating, unlike plasmids. Key points बस इतना ही है कि they are intracellular, one key point. Another is that they are non-replicating, and third is that discovered by the Barbara McClintock. ठीक है, now types of the insertion नाम देख लो, that is either insertion sequence or composite transposons, because questions are not asked from here, so let it go. So next we'll talk about the bacterial cell walls. Okay, that is we'll talk about the bacterial cell walls. Now cell wall is nothing but a protective rigid structure that is surrounding the bacteria, and functions we already know. It provides the production rigidity and toxic protect from the toxicity, and having the several antigens and the endotoxins that are what virulence in nature. Okay, now difference is important to remember. That is how we remember the endotoxin. That is what EN, that is NCN, that is present in the gram negative. और ग्राम नेगेटिव में क्या होता है, आउटर मेम्ब्रेन होता है, जो कि ग्राम पॉजिटिव में नहीं होता, आउटर मेम्ब्रेन है तो लाइपोपॉलीसैकेराइड होता है, दैट इज इट इज व्हाट लाइपोपॉलीसैकेराइड इन नेचर, जबकि एक्सोटॉक्सिन इज व्हाट प्रोटीन इन नेचर. एंड देयरफॉर वी नो दैट प्रोटीन जहां होता है वहां पे एंटीजेनिसिटी ज्यादा होती है, तो हाईली एंटीजन, तो क्रोक्सॉइड बनाना इजी है और टॉक्सिक भी ज्यादा होगा. ठीक है. एंड एक्सोटॉक्सिन is what it is more specific in action. Also the endotoxin is present in the outer membrane, LPS is nature, so it will be released upon only on the cell integration, while exotoxin will be secreted by the living organisms. Now they are poorly antigenic, they can not be converted to the exoids, and they are low antigenicity and give the fever and the shock. Now, one exception is what the botulism, Clostridium botulism, because the toxin is actually secreted by the bacteria and not by the lysis of the bacterial cell wall. So it is an example of, it is an exception, and it is actually the toxin is secreted because it is a gram negative, mostly gram negative or the endotoxin. So botulism toxin, Clostridium botulism is one of the exception. Now coming to the gram positive cell wall. Now gram positive cell wall, when we talk about the gram positive and the gram negative, ग्राम पॉजिटिव सेल वॉल इज सिंपल, जबकि ग्राम नेगेटिव सेल वॉल इज व्हाट कॉम्प्लेक्स. ठीक है. एंड हाउ वी रिमेंबर दैट पॉजिटिव मतलब प्लस, सो यहाँ पे टी बन रहा है, सो दैट इज हैविंग द टिकोइक एसिड. ठीक है. दैट इज द सेल वॉल टिकोइक एसिड एंड सेल मेम्ब्रेन टिकोइक एसिड, दैट इज एब्सेंट इन द कॉम्प्लेक्स और द ग्राम नेगेटिव सेल वॉल. सेकेंड इंपॉर्टेंट पॉइंट हमने कैसे याद किया था कि जो सिंपल दैट इज ग्राम पॉजिटिव सेल वॉल प्लस का साइन है तो कुछ एक्स्ट्रा है, दैट इज द पेप्टिडोग्लाइकन लेयर is much thicker, that is up to 50 to 100 layers thick. ठीक है. That is we have to remember this कि 50 to 100 layers of thick है. And what else we have to remember, we know that each layer is made up of the murine, and it is composed of alternative layers of the N-acetylmuramic acid and N-acetyl glucosamine. ठीक है. इनका क्या होता है, ऑल्टरनेटिव लेयर होता है. तो इनमें अपन को याद क्या रखना है, वी हैव टू रिमेम्बर कि ये जो साइड चेन्स होती है टेट्रा पेप्टाइड चेन्स होती हैं. ठीक है. दीज पेप्टाइड चेन्स दैट इज कंसिस्टिंग ऑफ द एल एलेनिन एंड डी एलेनिन. ठीक है. नाउ एल एलेनिन डी एलेनिन वगैरह है, दे आर कनेक्टेड टुगेदर विद द पेंटाग्लाइसिन चेन. ठीक है. दैट इज व्हाट, दैट इज द एल लाइसिन, वन tetrapentane extent is covalently linked to the terminal D alanine of the adjacent chain with pentaglycine bridge, and this pentaglycine bridge is not present where in the gram negative. So one we have to point, we have to remember is the pentaglycine chain is absent in the gram negative and it is present in the gram positive, and it is connecting what, the first L alanine to the fourth position D alanine. So this is important to remember, right? Now, this is a gram positive and the gram negative. Easy to remember, that is thick layer of the peptidoglycan. Also, the outer membrane is present only in the gram negative, not on the gram positive. Therefore, outer membrane में क्या होता है, LPS होता है, and LPS is responsible for the endotoxin release. क्योंकि LPS में जब हम पढ़ेंगे कि further 3 sub parts होते हैं, and A antigen is responsible for the endotoxin activity. ठीक है. Now, ticoic acid is specifically present in the gram positive. टिकोइक एसिड का काम क्या होता है, दो तरीके के होते हैं, वन इज द सेल वॉल टिकोइक एसिड एंड अनदर इज द लाइपोटिकोइक एसिड. क्या होते हैं ये लोग, दैट इज नथिंग, दे आर पॉलीमर्स ऑफ glycerol that are connected together by the phosphate group. Remember, they are polymers of the glycerol, cell wall that is present on the cell surface, and lipoteichoic acid that is present up till the cell membrane. ठीक है. Now gram negative complex होता है, we remembered. Also the peptidoglycan layer भी कम होती है, and they are made up of what, the murine that is similar to gram positive. What is the difference is that कि एक तो यहाँ पे पेंटाग्लाइसिन चेन नहीं होती है जो कि वहां होती है. नेक्स्ट इज दैट वन इज द मीजो डाई अमीनो Pymalic acid is present, which is absent in the gram positive. ठीक है, it is present as a third position of the tetrapeptide chain. ठीक है, so pentaglycine chain is absent and एक extra चीज present है, that is a meso diamino this pymalic acid. Now outer membrane is present only in the gram negative, and outer membrane अपने पास क्या होते हैं, poring channels होते हैं for the transfer of the ions and substances. Porin channels are also present in the gram positive also, but they are specifically present in the outer membrane of the gram negative, and it is firmly attached to the membrane protein that is called as the bronze lipoprotein. Remember the name, that is the bronze lipoprotein. ठीक है. Now talking about the LPS, अब lipopolysaccharide किस में प्रेजेंट हो, ग्राम नेगेटिव या ग्राम पॉजिटिव में? ऑब्वियसली ग्राम नेगेटिव में, क्योंकि ये कहाँ है, आउटर मेम्ब्रेन में, और आउटर मेम्ब्रेन ग्राम पॉजिटिव के पास तो है ही नहीं. ठीक है, सो इट इज पॉजिटिव प्रेजेंट इन द एलपीएस, और एलपीएस का सीक्रेट करता है एंडोटॉक्सिन, देयरफॉर एंडोटॉक्सिन इज सीक्रेटेड बाय द ग्राम नेगेटिव. ठीक है, एंड इट इज कंसिस्टिंग ऑफ द चेन ओ सी एंड ए. तीन सब टाइप्स होते हैं इसके फर्दर. तो एंटीजन लिपिड ए होता है, दैट इज व्हाट रिस्पॉन्सिबल फॉर द रिलीज ऑफ द एंडोटॉक्सिन. Core polysaccharide is nothing but the carbohydrate molecules, and the chain O is very important. क्यों? ये सबसे outer side है, ये somatic antigen है जो कि variability show करता है. Therefore the substrains of the strains of the bacteria are based on the variability in the O antigen because it is the most variable. Now coming to the cell membrane. Now cell membrane is based on the fluid mosaic model. We already know this. And one thing important to remember is that यूकैरियोट्स में क्या होता है, यूकैरियोट्स में स्टिरोल्स होते हैं जो कि एब्सेंट होते हैं प्रोकैरियोट्स में. ठीक है, नाउ प्रोकैरियोट्स में एक एक्सेप्शन है, that is what is known as the mycoplasma, that is also having a sterol. ठीक है, अब ग्राम नेगेटिव में स्टिरोल्स तो है नहीं, बट स्टिरोल्स जैसा कुछ है, that is what hopenoids. प्लीज रिमेम्बर दिस कि बैक्टीरिया की सेल मेम्ब्रेन जो होता है उसमें ना दिस यूकैरियोट्स में अपने पास स्टिरोल्स होता है, बट इट इज नॉट प्रेजेंट इन द प्रोकैरियोट्स. बट सम बैक्टीरिया कंटेन्स द स्टिरोल लाइक सब्सटेंसेस दैट इज नॉट एज अ hopenoids. Functions is easy, that is a transport and the special receptor molecule. Now coming to cytoplasm membrane, they lacks what, the membrane bound organelles. Ribosome is what 70s, that is 30s and the 50s. ठीक है, and the ribosome with the mRNA will form the polysomes. It is nothing but it is what, the ribosomes that are attached on the mRNA, that is forming what, the polysomes. Now one is the intracytoplasmic inclusion bodies, that is the organic and the inorganic. Now inorganic, that is the polymetaphosphate molecules or the Burbs agonist molecules that is present, or metachromatic granules that is present in the Corynebacterium diphtheria. इसके अलावा organic, the main function is that they are present in the nutritional deficiency and they will help in the survival of the bacteria. ठीक है. Now coming to the mesosomes. Now mesosomes, they are what? They are invagination of the plasma membranes, and they can be of vesicle form or the tubular form or the oval form. तो ऐसे याद रखो कि M से M, that is M to M, mesosomes are similar to what, the mitochondria, and mitochondria is what, the ATP house of the eukaryotes. Here it is the mesosomes that will perform the respiration and is the ATP house of the bacteria. Okay. Now next is the nucleoid, because bacteria doesn't have the nucleus, so the genetic material is what is irregularly shaped in the nucleoid form. Okay, and it is what the lakes basic proteins have. Some bacteria have a linear chromosomes and some two chromosomes are although present. Although bacteria contains what the single circular chromosome, and eukaryotes will contain what the multiple linear chromosomes, single circular chromosome, but some exceptions are wherever the linear chromosomes are present, the Vibrio cholera. Now next is what the cell wall appendages. Okay, now capsule and the slime layer, they are nothing but they are what the glycocalyx, and the capsule is, and the slime capsule is mainly of the polysaccharide and sometimes polypeptide, that is seen where in Bacillus anthrax. Although it is polysaccharide in nature, and same for the slime is what is also polysaccharide. क्योंकि दोनों ही ग्लाइकोकैलिक्स का मॉडिफिकेशन होता है, and when the slime of bacteria they join together irreversibly to form the biofilm that will provide the virulence and help in the protection of the bacteria against unfavorable environment, right? And in which organism the slime is present, that is the Streptococcus mutans, Staph epididymis, and Pseudomonas aeruginosa. Okay, if you remember, the Pseudomonas aeruginosa will form the slime that is called as algid, and that will cause what the cystic fibrosis. ठीक है, तो capsulated and the slime we need to remember. तो slime के क्या क्या examples है? Streptococcus mutans, Staph epididymis, and the Pseudomonas aeruginosa. That is, we need to remember, that is what the algid that will cause the cystic fibrosis in the person. So this was about the slime and the capsule and the biofilm. As you can see, this is what this is the regular formed glycocalyx around the bacteria. This is the slime that is irregularly formed around, and this is the biofilm formation. The examples of the slime we have seen, and the examples of the capsule by the mnemonic that we generally tend to remember. Now, this is for the capsule, that is some bacteria have effective paste surrounding membrane, and another mnemonic, yes, some bacteria have killed by the mnemonic that we remembered. Very important, please remember it by heart, the capsulated organisms. And one fungus, that is the cryptococcus, that is what capsulated, क्योंकि cryptococcus की इमेज ही आती है सीधे एग्जाम में. Other than this, one we saw about the Bacillus anthrax, that is capsulate was polypeptide. Now functions, it is actually what, actually capsule is what, antigenic in nature, right? And they are having no charge. Okay, so capsule is what, they are antigenic in nature and they are having no charge. While capsule of certain bacteria may be toxic to the host cell, induces the abscess formation by the biofilm formation and the adhesion. And they have also been used as the vaccine due to property of what, due to antigenic natures. Now demonstration we have seen there's a negative staining of the India ink preparation that we use for the staining of the capsule, and McFadden mainly used for the bacillus. And we have to remember the dye, that is the stain, that is the polychrome methylene blue stain. Okay, and negative staining Indianic we are also using for this, the Neisseria that we are using. Fueling's reaction mainly we are using for the Streptococcus pneumoniae, and the it is what methylene blue we are using. Tuning state में क्या होगा, refractile hollow like appearance of the capsule around the bacteria will be seen. Now this is nothing, this is the Culling's reaction, that is the swollen up refractile capsule around the bacteria is seen. Now another we talked about the India ink or the India ink and Nigrosin stain. Okay, what will happen here? The background will be black and the this capsule will appear as the refractile white in dark background. And in the McFadden reaction that we saw during the bacillus, वहाँ पे क्या होगा कि जो capsule polychromethylene blue की staining की वजह से capsule will appear purple colored around the bacillus. Okay, and bacillus are what? The bamboo shape. This is how the bacillus will appear, and the capsule will appear around the bacillus. Okay, now about the flagella. Flagella, one thing we need to remember is that they measures about 5 to 20 in length, and the flagella, they are actually the organ of locomotion and consisting of the proteins, that is flagellin protein. These are the key points to remember. Now, monotrichous, that is the single flower flagella in the Vibrio cholera and the Pseudomonas. The Campylobacter, Lopho means on board this multiple, Lopho मतलब कि tough, gucha, that is present in the spiralium. And Lophotope H. pyroli is also the Lophotrichus. Peritrichus मतलब पूरे surface पे, that is easy to remember, that is E. coli and the Salmonella, and Amphi on the both the sides, that is alkaligens. So examples are important. Organ of locomotion होता है, flagellin protein होता है, mono मतलब एक side, Vibrio cholera में, and the Campylobacter, if we know the image, we easily recognize it is mono. विब्रियो कैसा होता है, कॉमन शेप्ड होता है. कैम्पाइलोबैक्टर क्या होता है, कर्व्ड होता है, और एच पाइलोराई भी कर्व्ड होता है, बट एच पाइलोराई इज व्हाट लोफोट्राइकस एंड स्पाइरिलियम इज आल्सो लोफोट्राइकस. पेरी इज इकोलाई. Salmon amphi A से A, that is alkaligens. There is mono, amphi, lopho, and the peritrichus. Now structure, that is the filament, hook, and the basal body. फिलामेंट, हुक एंड द बेसल बॉडी. ठीक है, तो ये तीन स्ट्रक्चर्स होते हैं इसका, फिलामेंट, हुक एंड द बेसल बॉडी. बेसल बॉडी इज द इनरमोस्ट, देन द हुक, देन द फिलामेंट. ठीक है, फिलामेंट इज द लॉन्गेस्ट पोर्शन एंड द हुक इज व्हाट कन्वर्टिंग द बेसल बॉडी विद द फिलामेंट. ठीक है, नाउ डेमोन्स्ट्रेशन कैसे करते हैं अपन, डायरेक्ट या इनडायरेक्ट मेथड से. Just remember the name for the direct method that we are using is the Leifson's method. ठीक है, that is the tannic acid we are using. That is Leifson's, that is a tannic acid. ठीक है, indirect we already knows that hanging dog preparation and the Craigie's tube we are using. इसके अलावा semi solid media and the dark ground microscopy we are using. Remember, one is the Leifson's method and the indirect method which we are using. और बेसल बॉडी में, दैट वी रिमेम्बर दैट बेसल बॉडी में क्या होता है, 4 रिंग्स होते हैं और 2 रिंग्स होते हैं. ठीक है, अगर 4 रिंग्स है तो किसमें, ग्राम नेगेटिव में. व्हाट इज द रीजन फॉर द 4 रिंग्स इन द ग्राम नेगेटिव, हाउ वी रिमेम्बर कि ग्राम नेगेटिव में क्या होता है, आउटर मेम्ब्रेन होता है. ठीक है, एंड दिस ग्राम पॉजिटिव में आउटर मेम्ब्रेन एब्सेंट होता है, देयरफॉर ओनली 2 रिंग्स आर प्रेजेंट इन द ग्राम पॉजिटिव, दैट इज प्रेजेंट इनसाइड, दैट इज SM. बाकी जो rings है, that is L and P, they are present where, in the outer membrane. As you can see, they are present in the outer membrane. So L and P rings are present in the outer membrane, so they will not be present. जबकि PSM, you can remember, that is the positive. Gram positive is having the ring, that is S and M, and rest is present in the gram negative, क्योंकि उसके पास outer membrane है, तो चारों rings present हैं, क्योंकि 2 rings तो outer membrane में ही present होती हैं. Next is the fimbri. Fimbri or pali, that they are not the organ of locomotion. Remember, they are organ of adhesion. ठीक है, मतलब adhesion और attachment के लिए use करते हैं. There are 2 types, that is the common pili or common fimbri and the sex pili. Now, common pili is common, so they can be up to 1000 per bacteria. Sex pili, they help in the formation of the sex tube in those bacteria that is what, that is having TRA genes. Just a second, I got a call from the department. Charge. ठीक है, तो ट्रांजिन्स पे अपन थे कि जिनके पास ट्रांजिन्स होंगे सिर्फ उनके पास कैपेबिलिटी होती है क्या, सेक्स ट्यूब फॉर्मेशन की, और जिनमें बनेगा उनको अपन कॉम्पिटेंट बैक्टीरिया अपन कहेंगे, दैट इज they are a competent bacteria to form the sex tube. Now, the sex pili, we have already seen they are less in number, that is, they are long and less in number, up to 1 to 10 per bacteria. ठीक है, we can easily remember by this diagram. एक तो sex pili होते हैं, we can see अपन कम ही दिख रहा है, दो ही दिख रहे हैं, and another is what the common pili, that is numerous bristle like, that is present on the surface, and they are what, they are help in the attachment, and they are what, they are extending from the plasma membrane. Now detection, just remember one name, that is the detection we actually by the formation of the surface pili. This test mainly we do for the pneumococcus. Okay, now surface pellicle, it is a thin layer, and this actually we do for the pseudomonas, not for the pneumococcus, क्योंकि pseudomonas क्या होता है, pseudomonas अपने पास obligate arrow होता है, ठीक है, तो और विद द हेल्प ऑफ द फिम्बरी दे एक्चुअली अटैच टू ईच वन, मतलब अपने आप को अटैच कर लेते हैं, फॉर्म अ सरफेस फेलिकल, राइट, एंड दे आर, सिंस दे आर ऑब्लिगेट एरो, दे विल अपीयर एट द टॉप मोस्ट सरफेस टू गेट द ऑक्सीजन, ठीक है, सो दैट इज सीन इन द pseudomonas, and the surface pellicle test is used for to check for the detection of the fimbri. Just remember the one name, that is we see in the pseudomonas is the surface pellicle test. Okay. Now, some important modalities that we need to remember is that tumbling is seen in the listeria, gliding is seen in the mycoplasma, stately motility is seen where in the clostridium, darting we know that is seen in the vibrio cholerae and the campylobacter, ठीक है, एंड स्वामिंग वी नो दैट इज द प्रोटियस, लेकिन प्रोटियस के अलावा भी स्वामिंग मोर्टेलिटी, एक तो विब्रो कॉलरा पैरा हिमोलिटिकस दैट वी नीड टू रिमेंबर, एंड द क्लोस्ट्रीडियम टिटानी, okay, and corkscrew motility that we know, that is the spirochetes, that is a Trypanoma pallidum and all. So tumbling T set ulta ka to it is listeria, gliding is mycoplasma, that is stately for the clostridium, darting vibrio, very important, that is vibrio and campylobacter, and the proteus is not just shown by the proteus swarming, that is also shown by the vibrio parahemolyticus and the clostridium tetani. Okay, now it is the atypical form. Just remember, it is due to the absence of the cell wall. The atypical forms of the bacteria is present. No need to remember because the questions are generally not asked. One is the L form of the bacteria. That is what the cell wall deficient bacteria, discovered where it was discovered in the Lister Institute. So named as the L form of the bacteria, right? And it was discovered on which strain of the bacteria? That is the Streptococcus. Remember Streptococcus monaliformis. Streptococcus monaliformis पे क्या, listeria L form was discovered and in the Lister Institute. ठीक है, अब cell wall deficient bacteria can either be spontaneous or by the induction of the penicillin or the lysozyme. नाउ अब इसके दो फॉर्म होते हैं, वन इज अनस्टेबल एंड द स्टेबल, जो चीज नेचुरली प्रेजेंट है वो स्टेबल होगी, जैसे कि माइकोप्लाज्मा नेचुरली सेल वॉल डेफिशिएंट है तो वो स्टेबल होगा एनवायरनमेंट में, अनदर इज द अनस्टेबल दैट वी विल क्रिएट द मतलब हॉस्टाइल एनवायरनमेंट बाय द एडिशन ऑफ द पेनिसिलिन एंड द लाइसोसोम्स, एंड द एल फॉर्म विल बी formed. इसमें भी दो होते हैं, one is the protoplast and the spheroplast. When the bacteria cell wall is lost in P4P gram positive, it is the protoplast. And for the gram negative is the spheroplast. And gram negative only partially it is removed. So P से P, that is for the gram positive, it is what the protoplast, and the gram negative spheroplast. Now, coming to the bacterial spores, they are highly resistant, dormant. What is bacterial spore? It is nothing but it is a resistant, highly resistant dormant stage that is formed in unfavorable environmental conditions. And the layer sequence we have to now remember. कैसे remember क्या? Core का मतलब सबसे अंदर होता है तो core will be innermost. Then it is what the cortex. ठीक है उसके ऊपर अपन कोट पहनेंगे दैट इज द कोट एंड इट इज मेड अप ऑफ केराटिन लेयर जो कोट अपन पहनते हैं वो भी डेड मटेरियल वी कैन रिमेम्बर कि केराटिन लेयर एंड नेक्स्ट इज व्हाट द एक्सोस्पोरियम कोर इज द इनरमोस्ट विल कंटेन व्हाट द डीएनए मटेरियल तो कोर सबसे अंदर है सबसे भारी चीज को बचा के रखेगा दैट इज द डीएनए मटेरियल राइट एंड देन नेक्स्ट इज द कॉर्टेक्स दैट इज द थिकेस्ट लेयर ठीक है cortex is what that is the external layer and is the thickest layer then is the coat that is the keratin and next is what the exosporium now sporulation is the refers to the process of formation of the spores ठीक है in this unfavorable conditions while germination is the transformation of spores to the vegetative cells right and on the basis of it we'll read further in the this clostridium ki subterminal spores kahan hai terminal spores kahan hai because we need to remember just remember right now ki terminal spores ठीक है they are present in the clostridium tetani and the clostridium tertium right and we need to remember that it is the drumstick appearance in the tetany and it is what the tennis racket appearance in tertium इसके अलावा generally the subterminal spores are present in where the clostridium but these two examples are important to remember that it is terminal in the tetany and the tertium. Now this is a spore layer that we were talking about the core that is the DNA then is the membrane then the this cortex and the spore cortex, coat, and then the exosporium. Okay, and remember this the cortex is made up of the peptidoglycan layer because it is the thickest layer and it is made up of what the peptidoglycan layer. Next is the coat that they asked is made up of what the keratin. We already remember coat जो हम पहनते हैं वो भी keratin that is dead material. We remembered like this and the cortex the thickest or mostly thickness चाहे gram positive हो या spore which is provided by what the peptidoglycan. Yeah. Now next is the spoicidal agents. We already read that this agents that we use. What is the use of the spores that we have seen? And for the staining that we do is one is the gram staining, modified zine nasal staining. ठीक है modified zine nasal staining is performed using 0.25 to 5% of the sulfuric acid to decolorize. Now, what is the application? We have seen the spores of the Geobacillus stereothermophilus कहाँ use करते हैं Bacillus atrophius where it is used. We have seen that. Now, what is important in the culture media? So, this is the last, I guess, it will be over in 15 to 20 minutes. So, culture media में हमको याद रखना पेप्टोन. तो पेप्टोन कुछ नहीं होता, प्रोटीन्स होता है. अगार क्या होता है? अगार सॉलिडिफाइंग के लिए अपन यूज करते हैं. It is prepared from the seaweeds that we need to remember. It is prepared by seaweeds. Yeah, and it is the what is the preparation? It is mainly in the preparation of 1 to 2%, 0.5 this 0.5% or the 6% to inhibit the protease swarming, 0.5% for the semi-solid and 2% for preparation of the other culture media. Now types of the culture media we will read now. That is first is the simple media or the basal media. ठीक है दैट इज इट इज रिक्वायर्ड फॉर द ग्रोथ ऑफ द नॉन फास्टिडियस मीडिया ये बस कुछ नहीं है दाल रोटी चावल है सिंपल मीडिया है दैट इज रिक्वायर्ड फॉर एवरी बैक्टीरिया बट नॉट फॉर द फास्टिडियस क्योंकि फास्टिडियस बैक्टीरिया को अलग से बिरयानी चाहिए खाने के लिए फॉर इट्स ग्रोथ ठीक है तो एक्स्ट्रा न्यूट्रिशन चाहिए उनको नेक्स्ट इज द पेप्टोन वाटर वी नीड टू रिमेम्बर इट कंसिस्ट ऑफ वाटर दैट इज कंसिस्टिंग ऑफ NaCl water and the peptone, that is the peptides. ठीक है, एक न्यूट्रेंट ब्रोथ है क्योंकि यहाँ पे ब्रोथ आ गया तो यहाँ पे पेप्टोन वाटर प्लस मीट एक्सट्रैक्ट, न्यूट्रेंट अगार दैट इज न्यूट्रेंट ब्रोथ प्लस अगार, कॉन्सेंट्रेशन इज important. Next is semi solid, that is 0.5 to 1% of the concentration is required to for the semi solid. This is what the peptone water. दिस इज द न्यूट्रिएंट अगार. नाउ बेसल मीडिया का यूज क्या है, नॉन फास्टिडियस बैक्टीरिया के लिए, एंड अदर देन दिस टू सी द बैक्टीरियल ग्रोथ कर्व एंड द अदर टेस्ट दैट वी डू, एंड सेमी सॉलिड टू सी द मोटिलिटी ऑफ द बैक्टीरिया एंड मेंटेनिंग द स्टॉक कल्चर. एंड रिच मतलब रिच बनाना किसी मीडिया को, रिच मीडिया दैट इज बाय एडिंग ऑफ द ब्लड, सीरम और एग. ठीक है, सबसे पहले अपन बात करेंगे ब्लड अगार की. कॉन्सेंट्रेशन इज इम्पोर्टेंट, दैट इज 5 to 10% ऑफ द ब्लड ऑफ द शीप इज एडेड. ठीक है, एंड एट 45 डिग्री सेल्सियस, एंड ब्लड अगार इज एग्जाम्पल ऑफ बोथ द सेलेक्टिव दिस एनरिच मीडिया एंड द डिफरेंशियल मीडिया, क्योंकि डिफरेंशियल मीडिया का मतलब यही है दो बैक्टीरिया को डिफरेंशिएट करना ऑन द बेसिस ऑफ द कलर मॉर्फोलॉजी ऑफ द कॉलोनी. ठीक है, so this will show the partial and the complete hemolysis or no hemolysis, that is what gamma hemolysis. We read in detail about the alpha, beta and gamma hemolysis, about the streptococcus and the staph, and we'll in the again next revision class we'll read again. Now chocolate agar कुछ नहीं, chocolate agar is what heated sheep blood, और हीट कितना करेगा 70 डिग्री सेल्सियस टू लाइज आरबीसी, that will what release the factor number 5 that is needed for the growth of the H influenza. Yeah, now this is what, this is the chocolate agar that is needed for the growth of the H influenza. Now Loeffler serum slope is also a rich media that is needed by what the Corynebacterium, diphtheria. This is a Loeffler serum slope that is needed for the growth of the Corynebacterium, diphtheria, and the next is the enrichment media. This is what the liquid media. Please remember this. और इसमें अपन inhibitory substance डालेंगे जो दूसरी बैक्टीरिया ग्रोथ को inhibit करेगा, and the examples are very important. ठीक है, that is the tetrathionate growth for the Salmonella, gram negative for Shigella, selenite for the Salmonella Shigella, and alkaline will nature will promote the growth of the Vibrio and decrease the growth of the other coliforms. Okay, so this is the selenite F form bacteria, selenite F growth, and this is the alkaline peptone water. Next is the selective media. That is selective media is what S for S, that it is what the solid media. And the examples are important. That is one is the LG media we were using for the isolation of the MTB. इसके अलावा TCBS is also example of the differential media for the isolation of the Vibrio, deoxycholate and XLD for the isolation of the Salmonella Shigella, potassium telluride agar for the Corynebacterium diphtheria. Mannitol salt is important for the growth of the staph, and it is also an differential media because phenol red is what indicator. McConkey agar is both differential as well as selective, but more of the differential. This is the LG media showing the rough, tough, and the buff colonies. Rough, tough, and the buff colony, and green color is due to the malachite green. Now, coming next, this is the TCBS, thiosulfate citrate bile salt sucrose agar, that is showing the sucrose fermentation by what? By Vibrio cholera and giving the yellow colony formation. By parahemolyticus will not be give, therefore it is also what? Differential media as well. Now XLD that we are using for what? The Salmonella. You remember salmonella के और भी agar थे, that is the XLD we were using for the salmonella, and the deoxycholate citrate agar for what we were using the now salmonella shigella. Now cysteine telluride blood agar that is using for the Corynebacterium diphtheria, that will show the black color colony formation. Okay. Mannitol salt agar, the salt present in the mannitol salt agar, the salt present is what is used for the growth of the Staphylococcus. Okay, and it is selective for the growth of the Staphylococcus, and the mannitol will show the formation of the yellow colony formation. Therefore, it is an example of both differential media as well as the selective media as well for the Staph aureus. नाउ नेक्स्ट इज व्हाट द ट्रांसपोर्ट मीडिया का मतलब बस ये कि हमको सिर्फ ट्रांसफर करना है तो इट शुड ओनली रिमेन वायबल नीदर डिक्रीज नॉर इंक्रीज इन द कॉन्सेंट्रेशन ऑफ द पैथोजन और पैथोजन मरना भी नीचे मतलब देयर शुड बी कांस्टेंट वायबिलिटी ऑफ द पैथोजन हाउ वी रिमेंबर नाजीरिया दैट इज निजीरिया के लिए एमीज मीडिया एंड स्टुअर्ट्स मीडिया remembered for the Vibrio cholerae by cave, that is C for Caribbear, A for autoclave seawater, B for Venkatesha Raman and the Vibrio cholerae. ठीक है, and the Caribbear is also used for the Salmonella Shigella and very important media that is buffered glycerol saline media. P for P that is Pikes media for the Streptococcus pyogenes. Right now next is what the differential media, that is differentiate करेंगे दो बैक्टीरिया का by using an indicator. ठीक है, that will use an indicator that will show the color change. First most important is the McConkey. By the mnemonic plant we remember the composition, that is what the peptone, lactose, agar, neutral red and taurocolate, and neutral red is the indicator here and it is used for the lactose fermentation by the gram negative bacteria. ठीक है, now clade is preferred over the McConkey क्योंकि ये gram positive as well gram negative दोनों का lactose fermentation दिखाएगा and it is used for the staph as well as candida growth to see the fermentation, and bromothiamol is what the indicator for the clade agar and it is better than the McConkey agar. Now TCBS, that is thiosulfated bile salt sucrose, that is to see the sucrose and it is also an example of the differential media. Next is a Herc-Lifson's media that we see what we actually see the glucose metabolism. अब डिपेंड करते हैं ग्लूकोज मेटाबॉलिज्म या तो ऑक्सीडेशन से है या फर्मेंटेशन से है. अगर ऑक्सीडेशन से है तो दैट इज माइक्रो कस में है एंड अगर फर्मेंटेशन है तो इट इज स्टेफाइलोकोकस. The pronounce is Staphylococcus fur and micro, that is O, that is oxidative glucose metabolism. Plant we have seen, that is how the McConkey will appear. Now the mnemonic to remember is that the ships for the non-lactose fermenters, that is what Shigella, Yersinia, Proteus and the Salmonella. ठीक है, if it is non-motile, non-H2S, motile H2S, we have to remember this. The starting के दो are non-motile, non-H2S and rest two are motile H2S production. ठीक है, तो यहाँ तक आ गए अपन. दिस इज मैकॉन्की agar, दिस इज lactose fermenting pink colored colonies and non lactose fermenting colonies. Now one is that ki remember the lactose and non lactose fermenting colonies. Now one difference is in the McConkey agar, that McConkey agar में E. coli or Klebsiella will show the mucoid color colonies, while the E. coli will show what the non-mucoid and the convex colonies on the McConkey agar. This is the clade, that is the blue colored colonies, and it is what showing the lactose fermentation, that is the yellow colored colonies. The TCBS and now the anaerobic culture media. Just remember one, that is the Robertson cooked media that we are using for the Clostridium. ठीक है, and it is what the by using the beef this glutathione beef particles having the glutathione and it will consume of the oxygen causing the anaerobic colonies anaerobic media. Other is the thioglycolate broth, blood agar, brain heart infusion agar, ठीक है, and the bacterial bile aspirin agar. Just read out the names of some. Now this is the Robertson cooked media with the beef particles, meat particles having what the glutathione and mainly used for the clostridium growth, and इसके अलावा जो माइक्रो एरोफाइल्स होते हैं जिनको 5 to 10% of the oxygen is required for those growth. This is brain heart infusion agar, and this is PEA, that is phenyl ethyl alcohol agar. Now coming to some important examples, that is the obligate aerobe, that is only oxygen is required, that is the Mycobacterium tuberculosis, and next we read is what the pseudomonas. ठीक है, and micro aerophil, that is 5 to 10% is required, that is H. pylori, Campylobacter. ठीक है, obligate anaerobe we remember Clostridium, and facultative is E. coli. Just remember one is the micro aerophilic bacteria and the obligate aerobes. Blood culture media, remember what we have to remember in this is the culture method. That is one is the streak culture that we need to remember. That is streak culture. इसका बस ये याद रखने की एक जो loop जो होता है that is made up of the platinum or the nichrome, that is nickel and the chromium. Next is that ki how the loop is formed in the streak culture, that is the a circular loop, then a parallel and a tailing is done at the end of the inoculation. पहले अपन heat करेंगे loop, then we'll inoculate to take out the bacteria, and then we'll on the culture media will place this for this bacteria. Now this is the streak culture that I'm talking about. Is as you can see the tailing at the end, and it is used what it is used to isolate the bacteria in the pure culture. ठीक है, now next is the carpet culture, that is the carpet. As you can see carpet की तरह यहाँ पे क्या होगा, बैक्टीरिया को we will actually बिछा देंगे. अपन किस में यूज करते हैं, एंटीबायोटिक सेंसिटिविटी टेस्ट में अपन यूज करते हैं, और बैक्टीरियोफेज की टाइपिंग में अपन यूज करते हैं. ठीक है, प्लीज रिमेंबर इट. एंड फॉर द वैक्सीन प्रिपरेशन, very important that AST we use the lawn culture. Now this is the stalk culture, that is the zigzag formation in the containing agar slope, and it is used for the to see the pure growth, and for the urease test we use this. Now next is what the stab culture. As you can see, as a kisne stab now, so this is what the stab culture, and we see the gelatin liquefaction. We see in the bacillus, ठीक है, and to maintain to see the oxygen requirement and maintain the stock culture, remember to see the gelatin inverted tree appearance, gelatin liquefaction in the bacillus we use. Just see this diagram, this is what nothing but Macintosh and Phil's jar, no more use, and it is used for what, creating the anaerobic media. ठीक है, तो इसमें क्या अपन यूज करते हैं कि मिथाइलिन ब्लू यूज करते हैं एज द इंडिकेटर. ठीक है, reduced methylene blue remains colorless, and methylene blue is used as the indicator. Next is a gas bag and gen bag. Now physiology में we'll just see what, we'll just see the this graph that is important. ठीक है, सो पहले तो अपन बैक्टीरियल काउंट की अपन बात करते हैं, तो सबसे पहले अपन बात करेंगे जनरेशन टाइम का. ठीक है, तो जनरेशन टाइम का क्या होता है, बैक्टीरिया को अपने 2 डॉटर सेल बनाने में कितना टाइम लगा, इज अ जनरेशन टाइम. ई कोलाई का अपन को याद रखना है, दैट इज अबाउट 20 minutes. For the E. coli, it is what the 20 minutes, and for the Mycobacterium TB, it is about 10 to 15 hours, and the Lapre का 12 दिन. ठीक है, so E. coli का 20 मिनट, TB के 10 to 15 hours, and 10 to 12 days for the this Mycobacterium Lapre. ठीक है, बैक्टीरियल काउंट इज एक्सप्रेस इन टोटल काउंट. टोटल मतलब कि डेड और वाइबल बैक्टीरिया, एंड वाइबल काउंट इज एट ओनली द लाइव बैक्टीरिया. इस ग्राफ इज इम्पोर्टेंट क्योंकि अपन जब बात करते हैं लैग फेज, लॉग फेज, स्टेशनरी फेज एंड डेथ फेज, तो लैग फेज में क्या होता है कि एक्चुअली द एंजाइमेटिक रिएक्शन मैक्सिमम, दैट इज maximum size of the bacteria, because bacteria is adjusting to the environment and to the growth, so there will show the lag phase, maximum growth of the bacteria. Next is the log phase, where the bacteria will rise exponentially growth, that is a straight line growth is present. ठीक है, एक्सपोनेंशियल ग्रोथ होगी यहाँ पे और बैक्टीरिया काउंट सबसे ज्यादा होगा यहाँ पे. नेक्स्ट इज द स्टेशनरी फेज, स्टेशनरी दैट इज एस से एस, दैट इज द स्पोरुलेशन फेज, क्योंकि अब क्या हो गया है कि बैक्टीरिया का जो न्यूट्रिशन अब खत्म होने लग गया, सो स्पोरुलेशन will start taking place, and in the that phase, that is involution will takes place and the total count will increase but viable count will decrease. जबकि स्टेशनरी फेज पे स्टेशनरी फेज आ जाता है, इट इज टोटल काउंट एंड द वाइबल काउंट ऑल विल बी इक्वल. ठीक है, so this is what about the lag phase, log phase and the stationary phase. That is the stationary phase, the growth will cease although the total count will increase but the viable and the dead count will be same. ठीक है. Now this is the log phase, lag phase, that is only the size will increase. Log phase, number of bacterial cells will increase. Stationary, सब कुछ stationary पे आ जाएगा क्योंकि sporulation होगा और death will start taking place. Death में that is the dead count will be more than the viable count, although total count will increase in all but not in the lag phase. वहाँ पे सिर्फ size increase हो रही है. Now, factors affecting, that is obligate aerobes, these examples we have already seen, so no need to repeat the slide. Next is psychrophiles, that is below 20 degrees Celsius temperature. They show the growth. Okay, so we are done with the today's session, and please do use my code, that is the Muskan 10, to get 10% of the discount on the NEET PG subscription. So we actually covered the general bacteriology in one session. Now next we'll cover the systemic bacteria and the important points about them. So see you in the next session. I hope that everyone is preparing well for the examination, and do not forget to give the grant tests that are present on the Unacademy, totally free of cost, where the integrated clinical questions will be correlated to help you analyze your performances. Right? So do not panic and do not take tension. Whatever you prepared is enough for the examination, and it's just a matter of seven. And it's just a matter of what? It's just hardly a matter of the 3 to 4 days, and everything will be fine. Then you can enjoy right after the examination. But please do not lose the contact. Just lose contact with the studies right now, because something is better than nothing. I always say that whatever now you may not be able to retain it, but you will whenever you see the topic from your eyes and you see this photographic memory, this will help you to crack your question now, right? So please do attend today's live session. We'll taking around at 9 p.m. So we'll taking you the tips and tricks to help you solve your examination for the NEET PG examination with the Dr. Anshul Bansal. So I'll see you evening at around 9 p.m. and I guess he will be able to guide you much more than me for cracking the NEET PG examination, because he is the one of the topper who cracked the examination last year only, and he achieved a great rank in the All India PG as well as the Rajasthan examination. So see you tonight at 9 p.m. around. So be tuned to that time